fields as well. So it is a vitally important fund for our rural communities. And I actually took part in an event just a couple of weeks ago with the Angus Leader Programme, where they were launching their legacy report, which went into the detail about the programme there, looking at what worked, what didn't work, and how any future scheme could look. And it really highlighted the importance of Leader. Now, the Scottish Government absolutely believe that our rural communities should continue to be supported to deliver that locally led development, because that really is inclusive growth at its best. And that's why we've been absolutely clear and consistent in our position that we expect full replacement of EU funds from the end of this year to ensure that there isn't any detriment to Scotland's public finances as a result of Brexit. And we expect the UK Government to fully respect the devolution settlement in any future arrangements. But unfortunately, we don't have any clarity on that as yet.
Gillian Martin.
Thank the Minister for that. She also mentioned the Suckler beef report. Aberdeenshire Suckler herds form the backbone of quality beef production in Scotland. Can the Minister provide an update on the support that's been made available to that sector? And to what extent does the Suckler beef report provide a blueprint for the emissions reduction of food and farming production in Scotland and a sustainable future for one of Scotland's most important industries?
Minister.
I would echo what Gillian Martin said. It is one of Scotland's most important industries, and to quote what Jim Walker, who's the chair of the Suckler Beef Climate Group, had said, that the Scottish Suckler beef herd is the engine room that drives economic activity and environmental management across huge swathes of rural Scotland. And as far as funding is concerned for that, there's £40 million allocated annually to Suckler beef producers through the Scottish Suckler Beef Support Scheme, and that sits alongside other investment and support under Pillar 1 of CAP and through the SRDP. The Government obviously very much welcomed the recent report by the Suckler Beef Climate Group, because it recognises the need for the beef sector to significantly reduce its emissions while also increasing efficiency, productivity and the overall profitability of our producers in Scotland. And the scheme that's proposed sets out lots of practical ways for beef producers in the supply chain for ways that they can reduce emissions and really capitalise on the resulting green credentials that would be flowing from the suite of measures as they're proposed there. So we're confident that this scheme lays the foundations for a sustainable farming sector in Scotland, and we're currently considering all the details that have been published in that report and hope to set out our next steps to that very soon.
Thank you. Some supplementaries. The first from Oliver Mundell, to be followed by Colin Smith. Oliver Mundell.
Thank you, Presiding Officer. To ask the Minister if she recognises that maintaining food production on Scottish farms at current levels is vital to delivering on our wider climate change obligations, and does she agree with me that policies which simply incentivise our farmers to farm less and which outsource production to other countries, many of which have lower environmental standards, will do nothing to help our planet?
Minister Marie-Houjon.
I think we certainly wouldn't be wanting to see outsourcing anywhere, especially if that's produced to lesser standards than our own, given that we do have some of the highest and best environmental standards anywhere else in the world. But again, that's why these reports that I've highlighted today, so the Suckler Beef Climate Scheme, the report for farming from 1.5, we also have the Food and Farming Production Group as well. That's why all this work is so vitally important, because they, especially with those groups, Farming for 1.5 and the Suckler Beef Climate Group, they've developed measures that have been developed from people that are farmers, from people that work in the industry. And for Farming for 1.5, a lot of the recommendations they've proposed are, they've come from people from involved in farming, research, scientific background, environmentalists. And that's where I think it's important, because we need to have that buy-in to any measures that are produced. And I think between all these, between the different inquiries and between the different reports, I think that we really are gearing up to have a sustainable future for Scottish farming in a way that really drives down emissions, but does so in a sustainable way. So I look forward to when we can lay out our next steps once we've taken all these reports into consideration.
Colin Smith, to be followed by Mark Ruskell.
Thank you, President Officer. The Farming for 1.5 report is another useful contribution to the debate on the future of agricultural support, but once again organisations are being left to fill the vacuum left by the lack of policy from the government. So can the Minister tell us when the Farming and Food Production Future Policy Group's report will be published? And more significantly, when exactly will the government set out in detail their own vision for agricultural support beyond 2024?
Minister.
I mean, I know the member will remember when we had the debate back in January 19 when we first established the Farming and Food Production Group, and that really was to help us create and establish that policy, taking in all these wider considerations too. I mean, we absolutely recognise the urgency of this situation. We're in a climate emergency and there's a lot of work to be done there. But again, that's where all these reports from the various different groups are so vitally important, because they highlight, especially at Farming for 1.5, as Colin Smith mentions there, it highlights actions that can be taken in the short, medium and longer term, and practical actions that can be taken that are vitally important. So we've got to take all that information, consider all that in the round to help inform and develop our policies. And again, we hope to be in a position to lay out the next steps in relation to these reports very soon.
And Mark Ruskell.
Thanks. The Farming for 1.5 report clearly states that our subsidy system needs urgent reform if we're to achieve our climate goals. But the only scheme that's currently available to farmers specifically to tackle climate change is the Agri-environment climate scheme, and that's closed to new entrants indefinitely. So can the Minister confirm what is the future for that scheme, and when will farmers be able to access the financial support that they need to transition to low carbon farming with the urgency that's needed, particularly given that we're trying to recover the economy after COVID?
Minister.
Again, I appreciate the member's point, and we absolutely recognise the urgency with which this is required. In relation to the Agri-environment climate scheme that Mark Ruskell mentioned, the main issue with that has been that we don't yet have certainty over the replacement of EU funding, and that's despite repeated requests to the UK government. And once we have that clarity and certainty on how wider rural support, and in particular the current Pillar 2 activity is going to be funded, then we'll be able to decide how we proceed with that scheme. And as yet, we're still to determine whether or not to open that for applications to be funded in 2022, but we will absolutely make sure that whatever we decide in relation to that, that there is appropriate funding and support for farmers and crofters to play their part and to do more to farm sustainably, to enhance our environment and to help cut carbon emissions. But I would also say, as part of that as well, we had the pilot scheme recently, the Sustainable Agriculture Capital Grant Scheme, and that closed to applications earlier in October, and there were over 3,000 applications to that. And that was a £10 million fund to help fund agricultural equipment to deliver direct and indirect greenhouse gas emissions, as well as providing £1.5 million for the forestry grant scheme. So there are other things that we're looking at here. And again, we absolutely recognise the urgency. We're in a climate emergency, and we really want to do all we can to tackle that as best we can.
Thank you. Question 2, Liam MacArthur.
Thank you, Presiding Officer. To ask the Scottish Government what action it will take to improve the mental health support available to police officers and staff in light of the service reporting increasing numbers of absences.
Cabinet Secretary Hamza Youssef.
Well, first of all, we are, let me say, Presiding Officer, I'm sure we're all incredibly grateful for the hard work of all of our police officers and staff throughout this pandemic. They have shown incredible professionalism. The well-being of police officers and staff is of great interest to me, and I know of the Chief Constable as well. He and I speak about this issue on a regular basis. Police Scotland has been clear that maintaining and supporting the health and well-being of their workforce is a key priority, and our police officers and staff can access a wide range of services to care for their physical and mental health throughout the Your Wellbeing Matters programme. Police Scotland provide a range of support mechanisms to colleagues, including counselling services, post-incident trauma support, as well as proactive screening. They also have 200 wellbeing champions across the organisation who offer peer support, and officers and staff can download the Backup Buddy app to their mobile devices, which has been specially developed in recognition of the need to support the mental health of those in policing. Police Scotland and the Government, of course, recognise the impact of COVID-19 and the well-being of officers and staff, and quickly set up a well-being hub to coordinate information on support services that the workforce can access. Although there are a number of officers and staff absent due to COVID-19, Police Scotland report that the current level of absence is causing no significant issues operationally for the force.
Liam MacArthur.
Thank you. Of course, we owe a debt of gratitude to our police officers and staff, and no doubt COVID has made matters considerably more difficult, but these figures were on the rise well before the pandemic hit. A year ago, in response to figures Scottish Liberal Democrats compiled on working days lost to mental health, the Justice Secretary said he was, quote, very satisfied with the support offered to police officers and staff. Days later, independent research commissioned by the Police Federation showed half of officers stressed because they lacked resources, and 1 in 10 using drugs or alcohol to cope. FOI requests now show more days than ever being lost to mental ill health. So what is going wrong?
Cabinet Secretary.
Well, nobody argues otherwise that the job of police officers is an incredibly stressful one. It is one that deals with trauma day in and day out. It is one that Police Scotland recognise has to have a unique approach to mental health and mental well-being. So I've rifled off in my first answer a range of initiatives that Police Scotland have there to support individuals, to support police officers and staff for their mental health well-being. In addition, of course, the Scottish Government provided an extra £138,000 in financial year 1920 to extend the Lifelines Scotland Wellbeing Programme that is there for blue light responders, of course, including Police Scotland. In terms of the research by the Scottish Police Federation, I'm more than happy to sit down with the Police Federation to discuss this in more detail. I had a virtual meeting with them, a teleconference with them just a couple of weeks ago, but I'd be happy to touch base with them again to get more details of that research.
And Liam MacArthur.
That research was carried out almost a year ago, so that meeting should have taken place well before now. And one of the things the Cabinet Secretary didn't refer to is the staff survey. A full police staff survey is needed to properly understand whether their needs are being met. Last time round, only 8% of staff thought the National Force cared about their well-being. I've been calling on the Justice Secretary and police chiefs to conduct this survey for years. Due in 2017, it's still somewhere on the to-do list. How many more ministerial commitments and police meetings is this going to take?
Cabinet Secretary.
I would say about the planned survey, the wellbeing and engagement survey, I would say to Liam MacArthur, but I'm sure he's aware of this, that it's not for me to direct the Chief Constable when to do that survey. That is an operational matter, and you know, it is a source of frustration, and I know it comes from undoubtedly a good place from Liam MacArthur, but a source of frustration that he will continually ask me to direct the Chief Constable to do a survey that is very much in his operational responsibility. That being said, the Chief Constable and Police Scotland senior management have told me that they intend to hold the survey in February 2021. Of course, they may have wanted to do that earlier, but we all know the pressures the force has been under in these last 7 to 8 months.
And Liam Kerr.
Thank you, Presiding Officer. Recent figures show there's been a cut of over 650 divisional police officers since the creation of Police Scotland. Does the Cabinet Secretary think there could be a relationship between such a concerning rise in mental health absence and so many fewer officers? And if so, will he take steps to reverse the fall in numbers?
Cabinet Secretary.
Well, first and foremost, of course, there's over 1,000 additional officers since when we inherited office, and that is in stark contrast to when his party inherited office as part of the UK Government, where there have been cuts to police officers. So I'm proud to stand on our record. I should say, in terms of resource, the Scottish Conservatives pushed us in this budget to increase police funding by 50 million. We increased it by 60 million. So we are putting our money very much where our mouth is. In terms of divisional versus national resources, again, that is an operational matter for the Chief Constable, but it has been noted by groups like Rape Crisis Scotland that the national approach to tackling issues like sex offending has been so much better with the creation of the national force. So therefore, investing in those national capabilities for a consistent approach across the country, I think has been a welcome step. But these are matters ultimately operationally for the Chief Constable.
Thank you very much, and that concludes topical questions. We're going to move on now to our next item of business, which is a statement from the First Minister on COVID-19. The First Minister will take questions at the end of her statement. I would encourage all members who wish to ask a question to press their request to speak buttons. And I call on Nicola Sturgeon, the First Minister.
Thanks, Presiding Officer. 2 weeks ago, the Scottish Government published the new strategic approach to tackling COVID, and shortly afterwards we confirmed the level of restrictions that would apply initially to each local authority area. I indicated then that the allocation of levels would be reviewed on a weekly basis. Our intention, unless we consider more urgent action to be necessary, is to set out any changes on a Tuesday and for these changes to take effect the following Friday. Today is the first of these reviews, and I will shortly confirm the levels that will apply to each local authority area from Friday. However, I can confirm at the outset that the majority of local authorities will see no immediate change this week. I'll set out the rationale behind our decisions, and we are publishing on the Scottish Government website this afternoon detailed data for each local authority. Of course, it is important to be clear that these decisions always involve careful judgments as well as hard data. Firstly, though, I will report on today's statistics. The total number of positive cases reported yesterday was 832. That represents 9.5% of people newly tested and takes the total number of cases to 75,187. 293 of the cases were in Greater Glasgow and Clyde, 171 in Lanarkshire, 114 in Lothian and 90 in Ayrshire and Arran. The remaining cases were spread across the other 7 mainland health boards. 1,239 people are now in hospital, an increase of 12 from yesterday, and 102 people are in intensive care, which is 3 fewer than yesterday. I also deeply regret to say that in the past 24 hours, a further 39 deaths have been registered of patients who first tested positive over the previous 28 days. That means the total number of deaths under this measure is now 3,079. 2 weeks ago, that number was 2,726. Tomorrow's update from National Records of Scotland will give us a fuller picture of the number of deaths based on its wider definition. But even using today's figures, the fact that we have seen more than 300 people dying in the past 2 weeks is a sharp reminder of the heartbreak this virus causes and of why we must do all we can to tackle it. And once again, my deepest condolences go to all those who have lost a loved one. Presiding Officer, those who have lost someone or who are living with the long-term effects of COVID obviously carry the greatest burden of this virus. But I know everyone is finding the experience and the restrictions we are living under increasingly difficult. And I know the figures I report each day contribute to a sense that there is no light at the end of this tunnel. Throughout this pandemic, I've tried not to give false assurance. Instead, I've done my best to be straight about the challenge we face, and I'm going to stick with that approach, not least because, as will be obvious from my statement today, we do still face tough times ahead. But, and this is important, there are also grounds for optimism now. We're not at the end of the tunnel yet, but a glimmer of light has appeared. Yes, there will be dips in the road, and that means the light might be obscured at times, but it is very much there and we are heading towards it. Yesterday's news from the Pfizer vaccine trial was extremely encouraging. That's probably an understatement. And that, of course, is not the only vaccine undergoing trials just now. Of course, there are questions still to be answered and hurdles yet to be overcome, and it will take time practically and logistically to get large numbers of people vaccinated. But this was the most positive indication yet that science will get us out of this, and it will hopefully do so in the not-too-distant future. That is really good news. Of course, even the not-too-distant future is still the future. And that means, for now, it is down to all of us to keep the virus under control and save lives by sticking to the rules and guidance. But here, too, we have some cause for cautious optimism. The sacrifices everyone is making are hard and they feel never-ending, but they are helping. They have made a difference and they are saving lives. I have no doubt about that, and no one should be in doubt about that. To illustrate that point, let me give some detail on one of the measures, just one of the measures we look at each week, the average number of new cases per day over a continuous 7-day period based on the day when each test sample was given. In just 3 weeks, between Friday 25th September and 16th October, Scotland's average daily figure for new cases increased by more than 150%. It rose from 482 to 1,217. If that scale of increase had continued, we would now have around 3,000 new cases a day. But instead, in the next 3-week period, the number of new cases stayed at more or less the same average daily level. So by last Friday, the average daily figure was 1,174. There have also been some signs of a fall in hospital admissions. In the 7 days to 30th of October, 725 people were admitted to hospital with COVID. In the 7 days to 6th November, just last Friday, 545 people were admitted. So the point I'm making is this: there is no doubt that the restrictions we have put in place and that people are abiding by have dramatically slowed the spread of the virus. But of course, that figure for hospital admissions, more than 500 in a week, is still too high. The number of new cases we are seeing, more than 1,000 a day on average, is also still too high. And this is crucial. While we have seen a levelling off, we are not yet seeing a sustained fall in cases. In fact, although there was a very slight fall in some recent weeks, last week we actually saw a slight increase. Clearly, that requires continued caution. As I've set out before, a rising or even plateauing rate of infection is not a stable position. We want to see a decline in cases. So we'll be monitoring the situation carefully in the days ahead, and we can't rule out the need to take action beyond what I will set out today. Also, in light of the situation I've just outlined, it would clearly not be prudent to ease restrictions today, with one exception for our 3 island authorities, which I'll set out shortly. However, I can confirm that no local authority will move down a level this week. In light of particularly sharp increases in cases, unfortunately 3 local authorities will move up from level 2 to level 3. And while no local authority, I'm pleased to say, will move to level 4 this week, there are a number that are giving us some cause for concern, and we'll be monitoring these particularly closely over the next few days. I'll come on to the detail of all of that in a moment, but let me firstly set out again the indicators and the wider factors that we consider in reaching these decisions. We look at data for each local authority on case numbers per 100,000 of the population, trends in case numbers, test positivity and hospital and intensive care capacity. We're publishing the data that has informed our decisions for each local authority today, and you can look at it on the Scottish Government website. We also consider the extent to which different local authority areas are contributing to the situation across the country as a whole and the links and interdependencies between them. And we seek to balance the wider health, economic and social harms caused by the restrictions in place. We consider the advice of public health directors through the National Incident Management Team and consult with local authorities. Then Cabinet, with advice from the Chief Medical Officer, National Clinical Director and others, balances all of these factors and reaches decisions. So let me turn now to the detail of the decisions reached by Cabinet this morning. Firstly, I can confirm that Highland, Moray, Orkney, Shetland and the Western Isles will remain at level 1. However, there must be no complacency in these areas. Restrictions still in place must be adhered to and all necessary precautions taken in workplaces, hospitality, schools and colleges and healthcare settings. There is one restriction that we do intend to ease for people living in Shetland, Orkney and the Western Isles. From Friday, residents of these 3 island authorities will be able to meet with one other household inside their homes up to a strict maximum of 6 people. We're able to make this change because case numbers in these island authorities are very low and sporadic, and we recognise that the social isolation caused by such a restriction is often exacerbated in island communities where there are not as many public places to meet. However, and this is an important caveat, importation of the virus is a real risk to the islands. For that reason, we will also be issuing clear guidance advising anyone who goes to or returns to the islands from the mainland to avoid in-house mixing for a period after their return. Unfortunately, we don't yet consider it prudent to lift this restriction for people in Highland and Moray, the other level 1 areas. Although cases in these areas remain relatively low, we have seen some volatility in recent days. So to people living across the Highlands and in Moray, as for people in the rest of the country, we continue to ask that you do not visit each other's homes except for essential purposes such as childcare, looking after a vulnerable person or being part of an extended household. I know this is tough, but it remains the single most effective way of preventing transmission of the virus from one household to another. Let me turn now to those areas currently in level 2. I can confirm that Aberdeenshire, Aberdeen City, the Borders, Dumfries and Galloway and Argyll and Bute will all remain at level 2. These are all areas that will be hopeful, as I am, of a move to level 1 soon. However, while there are some signs of stability and even improvement in most of them, there is not yet sufficient evidence of a sustained decline in the number of cases. Indeed, I have to point out that in the Borders and, although to a lesser extent in Dumfries and Galloway, we have seen an increase in cases in the most recent data that we have available. For these reasons, we consider it sensible for these areas to remain in level 2 for now, but we do remain hopeful that some or all of them will be able to move to level 1 soon. The other areas currently in level 2 are Fife, Perth and Kinross and Angus. And I can confirm that we have taken the very difficult, but in our view, necessary and precautionary decision to move Fife, Perth and Kinross and Angus to level 3 from Friday. While on the raw indicators alone, Angus and Perth and Kinross are not yet meeting the level 3 thresholds and Fife is meeting just one of them, all 3 areas are on a sharply rising trajectory. The most recent data shows that in the space of a week, the 7-day number of cases per 100,000 of the population has increased in Perth and Kinross by 32%, in Fife by 40% and in Angus by 47%. The advice of the Chief Medical Officer and National Clinical Director is that level 2 restrictions may well not be sufficient to slow down and reverse increases of this magnitude, and as a result, an early move to level 3 was strongly recommended. I know how disappointing this will be to residents and businesses in these 3 areas. However, and this is an important point, by acting now, we can hopefully prevent an even more serious deterioration in the situation in future. I would ask people living in these areas to check the Scottish Government website to understand the restrictions in place at level 3. Businesses will also find details there of the financial support available from the Scottish Government, which of course is in addition to the UK Government's furlough scheme. Now, a factor relevant to both Angus and Perth and Kinross is proximity to and interaction with the city of Dundee. Dundee entered level 3 on 2nd November and I can confirm that it will remain at level 3 for now. However, I hope the 3 authorities going into level 3 this week will take some encouragement from it. The most recent data shows cases and test positivity declining in the city of Dundee. And while it's too soon to be sure that this will be sustained, I want to stress that the trend is very much positive at this stage. I can also confirm that the other 18 local authorities currently at level 3 will remain there for now. However, it is important to note that there is a varied picture across the level 3 areas, and a move to level 4 for some in the near future cannot be ruled out for reasons that I will outline. However, firstly, on the positive side, some of the current level 3 areas are, like Dundee, showing encouraging signs. There is some volatility in the most recent data for some of these areas, but I would mention, with varying degrees of confidence, East Lothian, City of Edinburgh, Clackmannanshire, East Dunbartonshire, Falkirk, Midlothian, North Ayrshire and East Ayrshire. Obviously, we will monitor all of these areas carefully, but we hope that if people continue to abide by all of the restrictions, we will continue to see improvement, and some of these areas may be able to move out of level 3 relatively soon. However, there are 2 categories of level 3 areas that we will be considering particularly carefully over the next week. Firstly, there are areas where current restrictions have worked very effectively to halt sharp increases in cases and stabilise the situation. That includes, in particular, the city of Glasgow and North and South Lanarkshire, but also I'd mention West Lothian and West Dunbartonshire. And that stabilisation is really positive news. Don't lose sight of that. Without the sacrifices everyone has been making, the situation would be much more severe. However, while cases have stabilised in these areas, they have stabilised at a stubbornly high level. And I've set out previously the risks of going further into winter with a high level of cases, even if it has plateaued. So the difficult question we must consider in the next days is whether more time in level 3 will start to reduce cases in these areas, or whether that is going to require more action. And finally, there are some areas in level 3 where we are in recent days seeing a sharp rise in cases. I have to point out to the Chamber that right now we are particularly concerned about Inverclyde and Stirling, and to a lesser extent South Ayrshire, Renfrewshire and East Renfrewshire. The advice of the Chief Medical Officer and National Clinical Director is that since these areas are already in the tougher level 3 restrictions, and given the need to understand the situations in these areas in more detail, an immediate move to level 4 would not be merited. However, their advice is that we should monitor the data for these areas closely and on a daily basis. Presiding Officer, given the severity of the level 4 restrictions, we will not take a decision to move any part of the country to that level lightly. In addition, we want to give the current levels more chance to work. But nor will we shy away from doing that if we think it necessary to limit the damage the virus can do, or if we think a short period at level 4 may be less harmful overall for an area than a prolonged period at level 3. These are really difficult decisions, and I want to stress that the week ahead is a particularly crucial juncture. And of course, I will keep Parliament fully updated. However, I want to stress this point. The best chance all of us have of avoiding a move to level 4, or indeed of moving our area down a level, is to stick with it and to abide by all of the current restrictions. I know fatigue is setting in and frustration is setting in too, but I appeal to everyone across the country, particularly if you might have been letting your guard drop recently. Please redouble your efforts in the days ahead. In particular, please do not visit other people's houses. That is the biggest risk of passing this virus from one household to another. We know, and we can show, I have done that to some extent today, that all of these hard sacrifices are making a difference. But the fact is, they will only make a big enough difference if all of us do all of the right things all of the time. That is tough, but it is the reality we face. Presiding Officer, finally, let me stress the travel restrictions that remain essential to a targeted approach to tackling the virus. These will remain in guidance over the next week, but we continue to prepare the regulations and resolve the practical issues that would be required to put them into law. We will not hesitate to do that if we think that is necessary. However, I appeal to people across the country to please abide by these travel restrictions now so that that doesn't become necessary. If you live in a level 3 council area, do not travel outside your own local authority area unless it is for essential purposes, such as work that can't be done at home, healthcare or caring responsibilities. You can find the full list of essential purposes on the Scottish Government website. And if you live elsewhere, don't travel into a level 3 area except for the same essential purposes. And please don't travel outside of Scotland to other parts of the UK or overseas right now unless it is for these essential purposes. Abiding by restrictions like these is hard. It's not a position any of us want to be in. But I can't stress enough that it is essential if we are to avoid spreading the virus from high prevalence areas to lower prevalence areas. Because if we do that, then those lower prevalence areas will end up being under tougher restrictions than otherwise necessary. Presiding Officer, there are many people across our country right now who are grieving the loss of a loved one. Too many people. Many more have lost jobs or are right now worried about losing their jobs. And of course, some people are living with the long-term health effects of COVID. For these carrying the heaviest burden of this virus, words are, of course, little comfort. But for all of that, and for all the fatigue, frustration and apprehension that we all feel, let's not forget that glimmer of hope. The numbers I report for new cases, people in hospital and dying, remind us that this virus continues to exact a terrible toll. And looking around the world just now, it's easy to see that if we are not very careful, things could get worse. But against that, we can also see that the sacrifices we make do have an impact and are having an impact. And yesterday's announcement about a vaccine is the best news we've heard since the start of this pandemic. One of the points I've tried to stress in the past few months is that at some point this will all be over. At some point we will be looking back on it rather than living through it. Today, though tough times do still lie ahead, that seems a bit more real, a bit more graspable for all of us. Of course, it doesn't remove the need for caution. It will be over one day, hopefully soon, but it is not over yet. So this is not the time to let down our guard. Now is the time to do everything we can to look after and look out for each other. The more we can keep each other safe in the weeks and months ahead, the more we can look forward to brighter days in the spring. So please, now more than ever, stick to the rules in your area. Check the website to see what they are, and please remember facts. Wear face coverings, avoid places with crowds of people, clean your hands and hard surfaces regularly, keep 2 metres distance from people in other households, and self-isolate and get tested if you have any of the symptoms of COVID. If we all continue to do all of this, all of the time, we will protect ourselves, our loved ones and our NHS, and we will undoubtedly save lives. My thanks once again to everyone for sticking with it and sticking with each other.
Thank you very much, First Minister. The First Minister will now take questions. Ruth Davidson.
Thank you, Presiding Officer. Yesterday's announcement on the efficacy of a COVID vaccine, and one that the UK has pre-secured 40 million doses of, should give us all grounds for cautious optimism. But the promise of an effective vaccine at the turn of the year does not override the ability of each of us to play our part now. The ongoing restrictions we're all living under continue to be difficult for the individual and in many cases crippling for shops, bars, restaurants, businesses and jobs. The way out of this, for everyone, is not just to have an effective vaccine, it is to be able to deliver it to the population in an effective and timely manner. We already know from the Health Secretary that we won't be delivering these vaccines under the same model as used for this year's seasonal flu programme because, as she rightly says, lessons need to be learned. The simple question that people will want answered is how exactly will this be delivered? Reports over the weekend discussed large-scale venues such as medical hubs and conference centres being used. I'm sure people would find it helpful if the First Minister could today give us some confirmation whether she can identify these venues at this stage and whether they've been secured for this purpose. Returning to this year's seasonal flu vaccine, many of the problems we saw arose from removing administration from GPs and handing it to health boards. Some health boards coped admirably. In others, there were significant and chronic problems. Is the First Minister satisfied that a national rollout of COVID vaccinations sees all Scotland's 14 health boards start at the same level of readiness so that this potential game changer can be administered fairly and equitably across the country, no matter where you live?
First Minister.
Can I thank Ruth Davidson for those questions and reiterate the point that until we are at the point of vaccinating large numbers of people, of course, it is incumbent on all of us to keep the virus under control by abiding by all of the restrictions, however tough I know that is. The Health Secretary will, over the next period, set out much more detail of exactly how we will deploy the vaccine and the programme that will be in place to ensure that it is delivered to priority groups across the whole of the country. In short, yes, we are confident that health boards will be at a level of readiness to deliver that. There will be a nationally coordinated approach to that, although delivery will be health board led. There will be a number of places and premises, including local places and premises like pharmacies across the country, that will be part of that programme. We will set out more detail of that once that detail is finalised or is finalising over the next weeks. We are also following and will continue to follow the recommendations from the Joint Committee on Vaccination and Immunisation on the prioritisation for the vaccine. Interim recommendations have been given. They were published by the UK Government yesterday, although they may be subject to change once the final properties of this vaccine and any other vaccines become more known. This is going to be one of the biggest vaccination programmes that we have ever undertaken. It will certainly be on a par to flu, although on the basis of the Pfizer vaccine, we would expect that people will need 2 doses 3 weeks apart. So there are even more complicated logistics involved in this. The Health Secretary is overseeing this on, I'm pretty sure, a daily basis, as am I, and we will make sure those details are set out as they develop and finalised to Parliament over the next few weeks. But let's not lose sight of the fact that this is good news. I don't want to underplay the questions that are still to be answered about the efficacy of the vaccine, the prioritisation of it, how much immunity it might confer. The scientists are working hard on all of this. But I think for the first time in 7 months, we do have that very distinctive light at the end of the tunnel. And hope's been in short supply over these past few months, so I think we should all enjoy it while we can.
Richard Leonard, to be followed by Alison Johnson. Richard Leonard.
Thank you, Presiding Officer, and can I thank the First Minister for advance sight of her statement. We all appreciate the balancing act needed between the harms of the virus and the wider damage inflicted by the restrictions themselves. Damage to businesses, damage to jobs, and the rising isolation, anxiety and loneliness of many across Scotland. Huge sacrifices are being made. The First Minister, in setting out the new framework only 12 days ago, said that, I quote, "Our aim is that the restrictions should be in place for as short a time as possible." But today, not one local authority area has been moved to a lower tier, and the whole of Fife, Perth and Kinross and Angus are being moved up to level 3 from Friday. All the evidence must be shared, and it must be persuasive. The purpose of the new strategic framework was to provide clarity and transparency in the government's decisions. But the announcement today raises more questions, not least about what it will take for communities to move down a tier. So what will it take? And why it is that the First Minister, after 8 months, is now contemplating the serious measure of applying the force of law to travel restrictions.
First Minister.
On that last point, we've never ruled that out over the past 7 months, but we have always encouraged across all of these measures voluntary compliance, because I believe, and our behavioural science advisors would, I think, back this up, that it is better to encourage and support people to do the right thing rather than use the force of law when they do the wrong thing. But we will not rule out, and haven't ruled out, and in fact have moved to a legal position on things like face coverings, and I think that is the responsible approach for any government to take. On the question of the different harms, obviously the virus does harm directly, and the way in which we tackle the virus does harm as well. But I think it is important for all of us to recognise that if we don't tackle the harm of the virus, then we exacerbate the other harms. We don't minimise them. I think there is, understandably, because everybody is frustrated and people are worried about jobs and businesses, a sense that if we just ease up on the restrictions to tackle the virus, then the economic harm won't happen. That is a fallacy. If we allow the virus to run out of control, the harm on the economy will be worse. But of course, we need to make sure support is in place while we do that, and we have put support packages in place. On the evidence, we will publish, it probably is published already, for every single local authority, a page of the most up-to-date data showing the direction of travel, cases per 100,000. You know, there is a wealth of data there that people can go and look at. But, you know, some pieces of data, it really can't be denied. If you look at Fife and Angus and Perth and Kinross, the figures I've just given of, you know, 40% or thereabouts increases in cases in the space of a week, no responsible government can ignore that, and acting early hopefully stops a greater deterioration. Yes, I would like to be in a position where we're moving local authorities down a level today. I would love to. But I am also in a position where, unlike other parts of the UK, and I don't mean this pejoratively, and we can't rule anything out for Scotland, but unlike other parts of the UK right now, we're also not in a full national lockdown. So we are making some progress, but this is an accelerating global pandemic, and therefore it is really important for all of us to be frank about the challenges we still face and the hard actions we have to take to make sure we keep it under control. And that's what the levels are intended to do, and that's what the weekly reviews and being prepared to change course when necessary are prepared to do as well. Finally, on when areas move up or move down, the broad indicators are set out. They were set out last week. They can be looked at on the website. But of course, around that, we apply judgment. So in Fife, Angus, Perth and Kinross, we've applied judgment that if we waited to next week until they might meet the raw indicators, the situation would have run more out of control. So by acting this week, hopefully we can get it under control more quickly. And that's where judgment has to combine with the hard data to reach these conclusions.
Alison Johnson, to be followed by Willie Rennie.
Thank you. According to an article published by The Guardian, and indeed other papers, a proposed move to cut the self-isolation period from 14 to 10 days is the result of a disagreement between Chief Advisor to the Prime Minister, Dominic Cummings, and Professor Chris Whitty. The specified 10-day period is apparently a compromise between the CMO and Mr Cummings, who pushed for an even shorter isolation period. So I'm sure the First Minister will agree with me that Dominic Cummings is the last person we should listen to when it comes to self-isolation. But he is a reminder that compliance with this crucial measure is still an issue. So can the First Minister confirm that Scotland will not support this move? Can she tell us what proportion of those asked to self-isolate comply, and what further actions her government can take to enable, support and increase self-isolation where it's required? Thank you.
First Minister.
So I have no advice at the moment to reduce the periods of self-isolation below what they are right now. I will always listen to clinical and scientific advice, so I cannot stand here and say that I will never get advice of that nature, and I will consider it carefully if I do. But it certainly won't be advice from Dominic Cumming. I hope that reassures Alison Johnson. But we will always consider that carefully. But as of now, let me be clear, we are not planning and have no plans to reduce the periods of self-isolation, because they, as they are right now, are based on the most up-to-date advice that we have. We are doing work to try to understand more the levels of compliance with self-isolation, and we, as Alison Johnson and others will be aware, there is now a proactive service in the start for people on low incomes, where local authorities reach out to people self-isolating. That will be one way of assessing compliance, but we are looking at other ways where we can monitor that going forward, and I'll keep Parliament updated on that. The self-isolation payment, I don't have figures in front of me right now, but we will publish the up-to-date figures on uptake of the self-isolation payment as soon as we are able to do that. But we are currently and actively looking at what else we can do over and above the payment, either through additional financial support or other practical measures to support people to self-isolate, because Alison Johnson is right, it remains not the only, but one of the most important things anybody can do. If you have symptoms, then you should self-isolate immediately and get tested. And if you're a close contact of somebody who tests positive, it is absolutely vital that you self-isolate. And the more we can do to support people with that, the more we will encourage higher compliance. So these are all matters under active consideration, and we'll keep Parliament updated.
Willie Rennie to be followed by Ruth Maguire.
Fife will want to know what we've got wrong and what we need to do to get back to level 2. Over the last few months and in other areas of Scotland, the First Minister has been able to say it's been pubs or indoor social gatherings. So what data is available from testing and tracing about the spread and the cause of the spread in Fife, as well as Angus and Perth and Kinross? The First Minister knows I am frustrated about the Scottish Government's slow pace of progress on testing. If they are testing all students in England for Christmas, what is stopping the First Minister doing the same for students in Scotland?
First Minister.
The only thing stopping me right now is the need to advise Parliament first, which the presiding officer I'm sure would insist on, and of course the Higher Education Minister will make a statement to Parliament tomorrow, setting out plans on that, and I am sure Willie Rennie will be heartened and encouraged by what he hears in that statement. We have a supply of what are called lateral flow testing devices. We are currently looking at the logistics of exactly how and the clinical prioritisation of using these, but without preempting the statement that will be made tomorrow, students will clearly be a priority for that. So I hope Willie Rennie will be happy when he hears Richard Lockhead's statement tomorrow. Can I say to Willie Rennie, I think we've got to be really careful, and I mean this genuinely, to use language like, what has Fife done wrong? This is an infectious virus in a global pandemic. With the best will in the world, sometimes people get it and sometimes people transmit it, and sometimes it can run out of control for a period. I think we've got to be careful about language that suggests people are to blame for that. However, it is important that we make very clear that all of us, through our individual actions, can help minimise that. We can't guarantee we won't get it, we can't guarantee we won't pass it on, but by following the facts advice, by abiding by all restrictions, we can minimise the chances. There will be, the situation in Fife right now, it has accelerated quite quickly. The figure I gave earlier on is that over the past week, and these are figures going up to the 6th of November, There's been a 40% increase in the cases per 100,000 of population. Over the same period, the positivity test rate has gone up by 1.5%. We have a rising projection for hospital and ICU admissions, although we are not at the moment seeing these being breached in Fife. There is not yet an absolutely clear understanding of exactly what the drivers of that might be, although the information that comes out of Test and Protect suggesting the contacts people have had in the 7 days before testing positive will be looked at in order to try to inform the local response to this. That is information that is provided through Test and Protect Public Health Scotland reports, but some of the information that I have set out just in the last few minutes is published today, and all members can go and look at it. And the hope is with Fife, with Perth and Kinross and with Angus acting quickly here, as we have reason to believe might be happening in Dundee, will bring this under control and lead to these areas being in tougher restrictions for a shorter period than might be the case if we waited and it ran further out of control.
Thank you. Ruth Maguire, to be followed by Maurice Golden.
Thank you. It's positive to note that measures in place in Scotland are starting to have the intended effect, and I appreciate the vast majority of the public understand the need for caution, particularly in light of increasing cases across the world. Presiding Officer, I've had a number of constituents with caring responsibilities contact me about advice not to travel outside your own local authority area, except for essential purposes. Would the First Minister take this opportunity to reassure them that taking care of loved ones is considered essential, and perhaps outline what other exceptions to the travel guidance there are?
First Minister.
I understand people's anxieties over this. Let me reiterate that these travel restrictions are necessary to stop taking the virus from high prevalence areas to low prevalence areas, and that is vital if we are to maintain a differentiated approach to restrictions. But there are exemptions to that for essential purposes, and the exemptions are set out in the guidance which is available on the Scottish Government website. But the kind of things would be to care for a vulnerable person, if you have to deliver food or other care to somebody who's old or vulnerable, if you have childcare reasons for travel, if you have to travel because of where you live, a reasonable distance, perhaps a few miles outside your own local authority for exercise, or if you have to do the same for essential shopping, if you cannot do that within the area you live in. These are the kind of exemptions that exist. But we are asking people where possible, and unless it is absolutely essential, to abide by these restrictions, because it will help us stem the increase in cases. Ruth Maguire, this information is available, but Ruth Maguire's own constituency area, North Ayrshire, of course, is one of the areas where we are seeing some cautious signs for optimism. I mentioned a moment ago in Fife a 40% increase in the most recent 7 days in North Ayrshire. That is a 12% decline in cases. Now, we have to wait to see if that is going to be sustainable, but it is one of the positive signs we're seeing right now, and it's down to the sacrifices people across North Ayrshire and elsewhere in Scotland are making.
Maurice Golden, to be followed by Bruce Crawford.
Thank you, Presiding Officer. The Scottish Tourism Alliance has warned the sector faces a third winter. There is funding available to the SNP to offer help if they choose to, £500 million unspent in their autumn budget revision, in addition to the UK Government providing Scotland with a £1.7 billion boost. So can the First Minister confirm how much of this will be spent protecting jobs and supporting Scottish businesses?
First Minister.
Firstly, let me make an important point, because I understand how difficult this is for businesses, and it's a point that has been recognised by the UK Government in the action they have taken through the lockdown currently in place in England, that if we don't control the virus, we do more damage to the economy in the medium to long term. And I know that is difficult for businesses that are struggling right now, but that is the reality. That's why the steps we're taking to control the virus are right for health and lives, but also ultimately right for the economy. We will invest every penny we can in supporting businesses. In addition to the UK Furlough scheme, we already have a package of business grant support, and businesses can find detail of that again on the Scottish Government website, and that is administered through local authorities. We are also also considering, over and above that, for particular sectors, what additional support we can provide, and we will set out details of that as quickly as possible. But there will be no penny that is available to us for this purpose left unspent, because it's vital when we are asking businesses to do unprecedented things that the governments across the UK give them, as far as possible, unprecedented support.
Bruce Crawford, who joined us remotely, to be followed by Monica Lennon. Bruce Crawford.
Thank you very much, Presiding Officer. First Minister, I know that you are aware that this current restrictions are having a huge impact on the hospitality sector in my constituency of Stirling. Unlike the Tories, I recognise that the Scottish Government's on a fixed budget, how difficult it is to find additional finance to support the sector. That being said, can I ask the First Minister what further can be done to support small to medium-sized hotels and guest houses, with restaurants in particular? And if that requires further support from the UK Treasury, then they should provide that. I know from experience on the ground that such businesses are desperate, and where they're required to close or because restrictions mean trading conditions are simply impossible, some will never reopen again. As a son of a hotelier, this sector is a sector close to my heart, and I feel deeply for them. So what can the Scottish Government do to help?
First Minister.
I very much share the member's concerns, and indeed the concerns of the member who previously asked the question with regard to the hotel sector and tourism and hospitality more widely. As Bruce Crawford will be aware, we've already provided £14 million through our Hotel Recovery Fund, a further £4 million for B&Bs and self-catering accommodation within a wider package of support, which now totals over £2.3 billion. We know that more needs to be done, though, to protect jobs and businesses into the future. The independent recommendations of the Tourism Recovery Task Force have now been published, and these will be considered by the Scottish Government and also by the UK Government, and that includes the recommendation to provide proportionate, fair financial compensation arrangements if further lockdowns are required. And again, the Tourism Minister will keep Parliament updated. Given that Bruce Crawford has asked a question and he, of course, represents Stirling, let me take the opportunity to underline a point I made in my statement, that Stirling is one of the the areas currently in level 3 where we have a significant concern about a sharply rising number of cases, and therefore it is going to be really important that people across Stirling redouble their efforts to stick to all of the restrictions to try to get that under control and avoid any potential move into the higher level of restrictions. And I know Bruce Crawford will be instrumental in encouraging his constituents to do so.
Thank you. Monica Lennon, to be followed by Annabel Ewing.
Thank you, Presiding Officer. On the glimmer of hope that is the COVID vaccine, what reassurance can the First Minister give that the public rollout of the vaccine will get underway as soon as it becomes available in Scotland? And to that end, because people have been raising questions, can she say in relation to cold storage and the supply chain around that, can she advise if we currently have any freezers that are capable of ultra cold temperatures such as the Pfizer vaccine, which requires minus 80 degrees Celsius, have freezers of that nature been procured, and if not, is work underway to do so?
First Minister.
Yes, we have purchased fridges, if I can use probably a completely untechnical term here, with apologies if I'm getting the figure wrong, because I've got so many figures going around my head on a daily basis, but I think from memory we have purchased around 20 of these very large fridges that are capable of storing the vaccine at those very, very low temperatures. Now, they will be situated in strategic locations across the country. There are then logistical issues in terms of getting the vaccines from the cold storage to where they need to be, and there are different temperatures that apply for short periods of time in that journey to the person being vaccinated. But all of these things are under very close and active consideration and deployment right now, including, I am pleased to say, the procurement of big fridges.
Annabel Ewing, to be followed by Rachel Hamilton. Annabel Ewing.
Thank you, Presiding Officer. I do not think it will come as a huge surprise to many of my constituents, or indeed to people across Fife, that Fife is being placed in level 3 given the significant increases in the numbers of COVID cases and indeed in admissions to ICU. Can the First Minister provide a bit more detail as to the decision-making process that was undertaken as far specifically as Fife is concerned? And can she provide assurances that the worrying increase in ICU admissions is being monitored closely? Thank you.
First Minister.
Yes, I can. But before I come on to the issue of ICU in particular, just let me very briefly go through some of the process. We've been identifying a rise in cases in Fife for a number of days, and during this weekly review process, the National Incident Management Team paid particular attention to the situation in Fife, and one of the reasons for that, as well as the rise in cases, was that ICU capacity has been a cause for concern. The figures for both incidence and test positivity have deteriorated, and also, and this is crucial to our decision to act early, the trend data suggests that without action, a further deterioration would be likely. So it's against that background that the National IMT advised moving Fife to level 3. That proposal was endorsed by Chief Advisors and the 4 Harms Group, noting that the local authority leadership had indicated that they understood the reasons for the need to follow public health advice. We're closely monitoring ICU admissions in Fife. Discussions continue to ensure that the NHS in Fife and elsewhere can cope with any increase in cases. Of course, there is the ability across the NHS and all health boards to double ICU capacity and, if necessary, to triple ICU capacity. So right now, we are not projecting that Fife will breach. It's certainly not breach its doubled ICU capacity. And if these additional restrictions have the effect that we want them to, then we should see that position improve even further. But let me assure Annabel Ewing that this will be something that is closely monitored in the days to come.
Rachel Hamilton, to be followed by Bob Doris.
Thank you, Presiding Officer. The First Minister will be aware that vitamin D is especially important in Scotland because Scots are at above average risk of deficiency, particularly in winter. Is the First Minister confident that the current supply of vitamin D to people shielding is sufficient? And will she answer campaigners' calls to extend the vitamin D scheme to care home residents in Scotland, as has been announced in England?
First Minister.
So supply of vitamin D has been challenged in recent months throughout the pandemic, but we are now in a position, and I think the text messages to people in the shielding category went out yesterday or in the last couple of days. We will be offering a supply, a 4-month supply of vitamin D to anybody who wants it in the shielded category. Of course, they also have to have advice about potential contraindications if they are taking other medication as well. The situation in care homes, which we are looking at right now in terms of whether we need to make any changes, and obviously supply will be a factor that we need to take account of. But the situation right now is that care home residents can, if they are clinically advised, access vitamin D. But the reason up until now that it has been based on clinical advice is to guard against contraindications with other medication they're taking. But we are currently looking to see whether we want to change that position in any way and make it available more on a par with those not in care homes in the shielded category. But right now, anybody in a care home who is deemed to benefit from vitamin D is able to get it.
Bob Doris, to be followed by Daniel Johnson.
Presiding Officer, we all know that the restrictions confirmed again today have a major economic impact, and due to the uncertainty caused by the UK Government's failure to extend furlough scheme until the very last moment, many employers have already made a difficult decision to make people redundant. However, it's important to stress employers can bring back people who have been made redundant and re-furlough them. Would the First Minister join me in encouraging employers, including a major theatre company group in Glasgow, and actually across the UK, that's been drawn to my attention, to urgently work to bring back any employees who have recently been made redundant in order to ensure they receive the support they deserve during the ongoing restrictions?
First Minister.
Well, although the extension of furlough is very welcome, I think, as was commented upon last week, it is regrettable that it came so late in the day where many businesses had already made people redundant, and many businesses, or some businesses, had probably decided to close businesses as a result of the uncertainty, or what appeared to be certainty that furlough was not going to continue on the terms that it now is. I would encourage any business in that position to consider bringing staff back, to take advantage of all of the support that is available. Obviously, I can't make decisions for every businesses, but the Scottish Government will try to offer whatever support we can to help businesses in those circumstances. And if Bob Doris wants to give us more detail of the situation in his constituency that he's referring to, we can certainly look to see whether there is further support we can make available.
Daniel Johnson, to be followed by Maureen Watt.
When the levels were first set on 4 out of the 5 measures, Edinburgh merited being placed in level 2. Despite improvement, the city remains at level 3, and many may ask why. Now, I understand these are judgments, not simple arithmetic, but in turn I think that requires greater explanation and transparency. So can I ask the First Minister to provide a full minute or report for the decision for each local authority to be published, including on the basis of the judgments that have been made, by whom and on what advice? And can I also ask for briefings to be provided to all elected members when level decisions are made, including councillors, as having spoken to councillor colleagues in Edinburgh, they are far from clear on the basis for these decisions?
First Minister.
Well, Cabinet makes the decisions. Let me be very clear about that. We do that after taking account of a range of advice from Chief Medical Officer, National Clinical Director, the National Incident Management Team, the 4 Harms Group. There is consultation with local authorities. The Deputy First Minister spoke to City of Edinburgh Council yesterday and had a discussion about the most up-to-date data we have published. I appreciate members may not have had the opportunity to see it yet. A page of data for every local authority. And I think most people, when they look at all of the local authorities, will see the reasons why we have arrived at the decisions we've arrived at. So Daniel Johnson says more explanation is needed in Edinburgh. So if I can say on cases per 100,000 in the most recent 7 days, the change in Edinburgh has been 0, so that it hasn't gone up, but it hasn't gone down. Before we could be confident about moving Edinburgh down a level with the significant opening up, that would entail we would want to see a reduction in cases, and we are hopeful that Edinburgh will see that in the weeks ahead. On test positivity in the last 7 days, the test positivity has actually marginally increased by 0.2%. So there is, that's marginal, but again, it is not showing us a sustained decline. So all of this data is published, and ultimately judgments have to be applied to it. We are in a precarious situation with an infectious virus. Moving an area down a level is not a neutral act. It involves an opening up, and an opening up involves greater transmission opportunities for the virus. So we have to be clear before we do that, that the authority concerned, the area concerned, has, if you like, the headroom to cope with that increased transmission. I hope that will be the case for the City of Edinburgh in the not too distant future, but on the figures we have right now, it would not be a prudent thing to do right now. Instead, it could run the risk of sending Edinburgh in the wrong direction.
Maureen Watt, to be followed by Jamie Green.
Thank you, Presiding Officer. First Minister, from Test and Protect, there's now much more information about where the virus is more likely to be contracted and spread. Can the First Minister confirm that the information gleaned from Test and Protect will be used when deciding which sectors can reopen, and that those sectors such as gyms and beauty salons, etc., can know if they have in the main been overwhelmingly safe or not?
First Minister.
Well, this is similar to part of Willie Rennie's question, and I want to be very clear about the benefit of the information, the value of the information we get from Test and Protect, but also be straight with people about the limitations of it as well. So we look very carefully at the information that comes out of Test and Protect. Effectively, what happens when somebody is tested positive, a contact tracer interviews them and asks them where they've been in the 7 days before they had the onset of symptoms. And that will tell you whether somebody has been in a pub or a restaurant, whether they've been to work, whether they've been visiting a family member, whether they've been to the hairdressers or a beauty salon. And that is valuable information because it allows us, it will also tell you whether somebody's travelled somewhere outside of Scotland or within Scotland. That allows us to build a picture and draw conclusions about the types of venues and premises that may be featuring more often than others. And at an earlier stage, that allowed us to say that pubs were, we thought, a higher risk of transmission, as well as the scientific evidence that would point to that as well. The limitation, to be frank, is that that information does not tell you absolutely where somebody got the virus. So because somebody was in a pub 2 days before they had symptoms doesn't mean that's where they got the virus. Genomic sequencing is required to get that level of information, and Scotland is doing a lot of genomic sequencing, which is very valuable. So we need to use this information, we need to use it sensibly, we need to understand its limitations, we need to help it, let it help us build pictures, and then we need to apply judgment to all of that. And in all of this, suppressing the virus is what we are seeking to do to allow greater opening up of the economy and society. If we don't suppress the virus, the hard reality is it gets harder, not easier, to open up, and that's not the position any of us want to be in.
Jamie Green to be followed by Willie Coffey.
Thank you. Presiding Officer, COVID has undeniably impacted those from Scotland's poorest communities the most. We now know that the percentage of pupils from deprived communities off school for COVID-related reasons is double that of wealthier areas. On top of that, the gap in overall attendance between these two groups is greater than in previous years. So can I ask the First Minister what she thinks is behind this growing gap, what the government is doing to address it, and will the government support our proposals for a national tutoring programme to ensure that these pupils who need extra help and support can access it no matter where they live in the country?
First Minister.
We'll consider all practical suggestions that are made. We're also providing a lot of support for children in low-income families, free school meals during the holidays, which I'm delighted to say the Conservatives now appear to agree with. We have just opened applications for the Scottish Child Payment. We have the Best Start grant. We have increased funding for the welfare fund. So in a whole range of ways, we're trying to provide targeted support where it is needed. There will be a number of reasons why the differentials in attendance figures at schools are as they are, and we look at that carefully. We look at attendance figures at schools on a daily basis, and the Deputy First Minister in particular pays close attention to them. Fundamentally, the most important thing is to take all of the necessary steps to support children to be at school and to support our schools to stay open for as long as possible throughout this pandemic, and that's what we are very focused on. And where we think there is a need to have additional measures in place to support that, or indeed provide additional help, we will always consider doing so.
Willie Coffey to be followed by Claire Baker.
Thanks, Presiding Officer. My question on vaccines has been covered, so instead, as a follow-up to Bruce Crawford earlier, could the First Minister please say something about the 6 p.m. restriction applying to restaurants in our level 3 areas? They're still losing all of their early evening dinner trade, and the relaxation recently hasn't really altered that very much, to be honest. Would the Government give some consideration to extending this to 8 p.m. perhaps, as it would make a huge difference to their ability to get through this, but still, of course, with the no alcohol rule in force?
First Minister.
We will always consider these things, and we will consider them on an ongoing basis. As the virus develops, we will look to open up and ease restrictions where we can. But there are some really hard judgments and trade-offs at the heart of this, and it doesn't do anybody any favours for me to shy away from being open about what they are. The issue around no alcohol is, of course, to try and remove the disinhibiting effects that alcohol can have and make it more difficult for people to socially distance. But the restrictions on hours are hard and not welcome for anybody, particularly businesses, but they are important as well, because we can't lose sight of the fact that one of the things we're trying to do is limit the numbers of people that come together, particularly indoors, and interact. This is a virus that thrives on passing from person to person, household to household. It does that more successfully indoors in places where there is poorer ventilation and where people might be less likely to observe social distancing. We know that people's own houses are at significant risk, but so too are pubs and restaurants. So the hours are not just about the not having alcohol, it's also about trying to strike a balance between allowing some businesses to trade to some extent, but also limiting the numbers of people that are coming together and interacting. It's really tough, but it is necessary. As I think all of the figures that I'm sharing with people today demonstrate, it's really necessary to continue to do that if we're to stop this virus running out of control again.
Claire Baker to be followed by Sandra White. Claire Baker joins us remotely.
Thank you, Presiding Officer. I would like to seek some clarity. I did look on the Scottish Government website to look for business support, and I understand that the Coronavirus Restrictions Fund closed applications on the 3rd of November. Perth, Kinross and Fife have both moved from Tier 2 to Tier 3. So I'd like to ask how businesses will be able to access the higher level of support that comes along with Tier 3.
First Minister.
The support that's been available, the grant support, there are two levels of grant, for one for businesses that have closed and one where trading is restricted, will be available to any businesses on an ongoing basis. There was the temporary measures for the temporary restrictions. That's now been replaced by ongoing support. I will make sure that somebody sends an email later this afternoon to Claire Baker about exactly where that information can be found and what exactly the process businesses in the areas newly going into level 3 have to do in order to access the support. But the support is there for businesses who either have to close or will have their trading restricted.
Sandra White to be followed by Annie Wells.
Thank you very much, Presiding Officer. First Minister, you just mentioned a couple of minutes ago the Scottish child payment which opened for applications yesterday. I really believe it will be a game changer to help lift thousands of kids out of poverty in Scotland. Can I ask how much families with young children may receive or could receive if they apply for the Scottish Child Payment together with the 3 Best Start grant payments and Best Start Foods?
First Minister.
Well, I'm very pleased to say that the Scottish Child Payment, which is the newest and biggest benefit so far under our new benefit system, opened for applications yesterday. Scotland is the only part of the UK where this additional payment for families with young children will be available, and it is a significant anti-poverty measure. The new benefit will give eligible families on low incomes with children under 6 initially, ultimately children up to 16, an extra £10 per week for each child, and the Scottish Child Payment, taken together with the Best Start Grant and Best Start Foods, will provide over £5,200 of financial support for families by the time their first child turns 6. For second and subsequent children, that will provide over £4,900. So this is significant support for families who most need it, and I would encourage anybody who thinks they might be eligible to make an application and make sure that if you are eligible, you get this support.
Annie Wells to be followed by Stuart McMillan.
Thank you, Presiding Officer. The Government's winter plan stated some resumed services may have to be paused again should we need to create more capacity to deal with COVID-19 resurgence or manage other winter pressures. This appears to be already happening, with several health boards recently announcing the cancellation of non-urgent elective procedures and the warnings of bed shortages. It is vital that the NHS is not plunged into crisis this winter. So can I ask, what is the current available bed capacity in the NHS and how many of these beds are staffed?
First Minister.
I think, broadly speaking, and if I'm getting this number not exactly correct, I'll be corrected later, but around 13,000 bed capacity in the NHS, and we have a contingency within that for COVID. It is absolutely, at the start of the pandemic, of course, we paused all, apart from necessary and life-saving treatment, we paused elective treatment to ensure that that capacity was there for COVID. We do not want to do that again. There will be pressures at given times which interrupt elective and planned procedures, but the absolute priority here is to keep the virus under control so that the NHS can cope with COVID and treat patients who have COVID, but also treat patients who need it for other reasons. And that is one of the main reasons that these restrictions are so important, and why I know, and it is understandable and it's entirely legitimate, that people will press for relaxation here or there for this sector or that sector, and I get all of that. I make no complaint about that. But the reason we have to make sure we take the necessary action to stop the virus running out of control is to save lives, stop people becoming ill, but ultimately as well make sure that we protect the capacity of the NHS over the winter, when even when we don't have a pandemic situation, the pressures on it are greater than they are at other points of the year. And that is the purpose of the winter plan that the Health Secretary has already spoken about.
Stuart McMillan to be followed by Alec Rowley.
Thank you, Presiding Officer. Sadly, there has been a significant increase in cases in Inverclyde in the last week, and can the First Minister commit to continuing to work with Inverclyde to seek to keep cases of COVID down, and also remaining engaged with the local community and also the local authority if Inverclyde is at risk of more restrictions?
First Minister.
I absolutely commit to continuing to work with Inverclyde, with the local authority there, with the public health authorities to make sure we're doing everything we can to get cases down. The increase we've seen in Inverclyde in the last 7 days is very significant. It is more than 100%, and that obviously has to be taken very seriously. There's been a 2.1% increase in test positivity. I know that when we didn't put Inverclyde into level 2, when we first set the allocations, there were people in Inverclyde, understandably at the time looking at the data, who questioned that. I think the experience since then probably suggests that was the right thing to do. But we need to make sure, if we are to avoid tougher restrictions for Inverclyde, that we all work together to make sure the current restrictions are being adhered to and the authorities locally are working in as targeted a way as possible to get this transmission down. And what we know from other parts of the country is when that happens, it can be done. And I hope Inverclyde and the people of Inverclyde take some encouragement from that.
And Alec Rowley.
Thank you, Presiding Officer. Well, the announcement yesterday on the vaccine was very welcome. Does the First Minister acknowledge that there is a danger that that causes people to take their eye off the ball in terms of the spread of this virus? I welcome, I think, the announcement that's going to be made tomorrow in universities, although European universities have been carrying out mass testing for many months and haven't seen the kind of problems we've seen. And specifically to what's happening in Liverpool with the UK government and being talked about being rolled out elsewhere in terms of mass testing, is that something that the Scottish Government's looking at? And what's your view in terms of seeing mass testing, particularly in those areas in the west of Scotland that are being impacted worse?
First Minister.
So we are considering all of these things in short. Obviously, students, given the looming Christmas period, are a priority. Health workers, I think Parliament will also debate tomorrow, another priority. And then using testing, whether it is current PCR testing or new testing technology like lateral flow tactically in outbreak or high prevalence areas is also under consideration. There are some logistical, practical, clinical issues that we have to consider around all of this. The procured supply of some of these devices, the ways in which they can be used most effectively. There is a lower sensitivity, I think, not specific about how specific they are, it's about how sensitive they are, lower than PCR. So in some cases where they're being used, they have to be used more than once in a short space of time, and where people test positive, obviously, often they require to be followed up with a PCR test to confirm that positive. So these are the things we're working through right now. We'll set out the first steps in that around students tomorrow and keep Parliament updated more generally. Finally, on the vaccine, you know, like most people in my position, I've had to deliver so much bad news over the past 7 months. Forgive me if I've enjoyed the ability to be a bit more positive over the past 24 hours. But of course, there's a long way to go, and I think we all have to be open-eyed about this. But it is good news, and probably, as I said, the best news we've had. But if there is a risk to it, it's that people sit back and say, well, we can just wait for the vaccine and we don't have to bother with the restrictions anymore. That is not the case. We have to right now make sure we stick with all of these restrictions. Frankly, to make sure that by the time we get, hopefully to the spring, and the vaccine is helping us come out the other end of this, we get to that stage with as few lives lost as possible, with as little ill health as possible, and with the burden of COVID being as minimal as we can possibly make it. And that takes all of us continuing to do all of the right things all of the time at the moment.
Thank you very much. And I'm afraid, apologies to members who couldn't call, but we have to end proceedings there. We're going to move on to the next item of business shortly. A short pause.
Thank you. I remind members that social distancing measures are in place in the chamber and across the campus. Please observe these measures, including when entering and exiting the chamber this afternoon. The next item of business is a debate on motion 23291 in the name of Graham Day on Remembrance commemorations. Can I ask those members who wish to speak in this debate to press their request to speak buttons now? And I call on Graham Day to speak to and move the motion.
Presiding Officer, each November Scotland comes together to pay tribute and honour the brave men and women of our armed forces who for generations have served to protect the liberty and freedoms we all enjoy today. The poppies we wear are a tangible symbol of remembrance and the enduring courage, loyalty and commitment of our regulars and reservists. They show that no matter how much time may pass, their sacrifices alongside those of their families and loved ones will not be forgotten. This year has seen some truly significant anniversaries of key events from the Second World War. May 8th saw the nation commemorate the 75th anniversary of victory in Europe, marking the fall of Nazi Germany and the end of conflict on the continent. The 12th of June marked 80 years since the Battle of St Valery, sometimes known as the Other Dunkirk, which saw outstanding bravery displayed by the men of the 51st Highland Division, winning 6 Victoria Crosses and many other medals for their valour in the face of inevitable defeat. And August 15 saw the nation commemorate the 75th anniversary of victory over Japan Day, which marked the end of the conflict in the Far East, finally bringing the Second World War to a close, a war that saw over 50,000 Scots lose their lives. Earlier this year, I had the privilege of talking to Jack Ransom, one of the last surviving prisoners of war who were forced to work on the infamous Thai-Burma Railway, also known as the Railway of Death, and Jenny Martin, who was born in a prisoner of war camp in Singapore and spent the first 3 years of her life under armed guard. Their experiences and the experiences of millions of others around the globe should not be forgotten. These anniversaries may be among the last significant commemorations for which we will have the opportunity to directly thank the veterans of these events for their service. We therefore, as a government, worked in partnership with Legion Scotland and Poppy Scotland, with support from the Armed Forces, to plan an appropriate series of events to mark these dates. The May 2020 bank holiday was moved to coincide with the 75th anniversary of VE Day. Sadly, the coronavirus pandemic made it impossible to carry out some of these commemorative events, such as the planned VIP reception for Second World War veterans, followed by a parade and a concert for the public on VE Day, in the manner that we had intended, due to the risk of public gatherings spreading the virus and endangering lives, a risk which also very significantly impacted the nature of Remembrance Sunday commemorations at the weekend there. The decisions that have been made that resulted in restrictions to events have not been easy ones to take, but it is right that we've prioritised suppressing the virus to save lives. We'll continue to work with our partners in the hope that we'll be able to arrange a suitable alternative next year for the live events that have had to be postponed, which will allow us to host the veterans who would otherwise have attended this year. However, there have been many achievements in ensuring that the commemorative events have been able to proceed safely in some form throughout the pandemic. And I want to take this opportunity to acknowledge the incredible efforts of veterans' charities, local authorities and local communities in adapting to ensure this happened. In particular, I want to commend both Legion Scotland and Poppy Scotland for the enormous amount of work they've done to ensure that commemorative events have been able to take place safely and successfully. I appreciate how challenging this has been, given the uncertainty and the efforts that have been required by a huge number of staff and volunteers to manage it. Presiding Officer, these events, though, have arguably, at least in terms of reach, been an even greater success than normal as a result of the efforts that were made. They've reached millions of people across the country and indeed across the world. The various live broadcasts produced by Legion Scotland and Poppy Scotland for VE Day, VJ Day and the Battle of St Valery have reached more than 6 million users on social media, with the virtual events being viewed more than 500,000 times. Now, I know it's not the same as a real live event, but it shows you what can be achieved, and it's a tribute to the innovation and the imagination that was showed by our veterans' charities in difficult circumstances. The hashtag @StValery80 reached more than 137 million social media users globally, with 450 pipers across the globe taking part, making it the largest ever mass participation piping event as they performed the march Heroes of St Valerie, which was composed by Pike Major Donald McLean, one of those captured during the battle. For VE Day, Legion Scotland hosted an online commemoration service, which the First Minister delivered a reading at. This was followed by an online concert featuring many of the artists who had been due to take part in the planned event at Princess Street Gardens. Representatives of the armed forces joined the First Minister for a 2-minute silence outside St Andrew's House, and a fly-past by RAF Typhoons took place over Edinburgh Castle. Following the success of VE Day, Legion Scotland took a similar approach to Victory over Japan Day with a virtual service of remembrance and a tribute concert featuring the stories of some of the incredible men and women who lived through the war in the Far East. Sitting alongside this, the Scottish Government worked with Poppy Scotland to create educational resources to mark both events that were made freely available to schools. And following the announcement of school closures, Poppy Scotland digitised these resources and made them available for pupils to support home learning activities. Legion Scotland, as many of us are aware, also provided victory medallions and letters of thanks to Second World War veterans prior to VJ Day as an appreciation of their contribution to the Allied war effort. And I know from speaking to a number of these veterans and from their letters to me just how much that was appreciated. Following on from this, Legion Scotland and Poppy Scotland have looked to replicate this success with a programme of virtual activities around Remembrance 2020. The National Service of Remembrance took place on Sunday at the Scottish National War Memorial in the Castle and was broadcast by the charities via their Facebook and YouTube channels. They'll also broadcast a virtual service of remembrance for Armistice Day tomorrow from around 10:45 a.m. And I would encourage all who can to join the service and the 2-minute silence at 11 a.m. Although for MSPs, there will be a remembrance opportunity facilitated here in the Parliament as well. Presiding Officer, the work undertaken for these events, as well as the numerous local services being held across Scotland, both honour the fallen and afford an opportunity to support veterans and recognise current service personnel. They are also vital in ensuring that our young people continue to learn about and engage with the impact of conflict and the cost of war, and ensure that they are proud to honour those who sacrificed their future for our tomorrow. I want also to take this opportunity to reiterate our continued support for the Scottish Poppy Appeal and the important work it funds all year round within the armed forces community across Scotland to help those who have served, those still serving and their families by providing the care and support they may urgently need. The Poppy Appeal relies on the dedication and hard work of a huge number of volunteers across the country, and without them it would be impossible to raise the vital funds used to deliver support to former service personnel and their families. All monies raised in Scotland goes back to the armed forces community here, and I want to give my personal thanks as Veterans Minister to all who are involved in this. And I particularly want to note the innovative merchandising of Poppy Scotland. Last year saw the introduction of badges featuring the crests of football clubs alongside the Poppy. That range has been refreshed this year, along with the introduction of a range featuring the badges of Scotland's historic regiments. I'm pleased to have been able to rotate between my brand new Aberdeen FC lapel badge and one featuring the crest of the Gordon Highlanders, the regiment in which my grandfather served. Scotland has a large and vibrant armed forces community, and the role of the charity sector is essential in delivering valuable support to veterans right across Scotland. And I'm sure that I can speak for all in the chamber today when I extend my heartfelt thanks to everyone who worked on behalf of these charities in whatever way they have, and congratulate them on the funding, the innovation they've showed around funding to raise these critical sums of money which are put to such good use. For our part, the Scottish Government remains committed to supporting our armed forces and veterans community and ensuring they do not experience any disadvantage as a result of their service. Since I became Minister for Parliamentary Business and Veterans, I've been fortunate and indeed humbled to hear the stories and experiences of veterans whose service has varied from during the Second World War through Korea to more modern operations in Iraq and Afghanistan, and inspired to ensure going forward we in Scotland do what we can to remove barriers to current and former service personnel enjoying access to the services and support they and their families need. We recognise that our veterans and their families are real assets to their communities, employers and this country, although there are a small but important number of veterans who struggle to make the transition to civilian life and need additional support. We're keen also to maximise the potential and opportunities for all of them, for example, in finding good quality, sustainable employment. And I intend to expand on that, Presiding Officer, in my annual report to Parliament next week. Tomorrow sees the 101st anniversary of the first Armistice Day on the 11th of November 1919. Armistice Day and the Remembrance period more broadly serves a vital purpose in allowing everyone in Scotland a moment to pause, reflect and be thankful to those who have made the ultimate sacrifice for the country and the families and loved ones that they left behind. I've focused so far on the anniversaries of the First and Second World Wars, but it's also important that we remember those who've served in other theatres throughout the years since then in Korea, Suez, Kenya, Northern Ireland, the Falklands, Iraq, Afghanistan and all the other corners of the globe. We should also recognise and be thankful for the vital humanitarian work carried out by the armed forces at home and worldwide, exemplified by the support they've provided during the pandemic, both nationally and locally, such as their aid in the building of the NHS Louisa Jordan in Glasgow and the deployment of thousands of personnel at short notice to support testing for the virus. Presiding Officer, remembrance and commemorations throughout the year serve a vital purpose to the people of Scotland in allowing time for reflection on the sacrifices made to protect our freedoms. I'm grateful for the work that's been done by our partners in the third sector to ensure that these events have been a success in the face of the enormous challenges posed by the coronavirus pandemic. We will continue to work with them to ensure that this success is built on in future. Presiding Officer, I move the motion in my name and I look forward to the contributions of members and responding to these in due course.
Thank you, Minister. I now call on Maurice Corrie.
Thank you, Deputy Presiding Officer, and I declare that I am an Armed Forces veteran and also convener of the cross-party group for Armed Forces and Veterans community here in this Parliament. It is indeed a real privilege this afternoon to be taking part in this debate and also leading the Scottish Conservatives in the debate itself. And we shall be supporting the motion at decision time tonight. Can I just put on record the appreciation that we have for the work that the Veterans Minister has done in the past year for our veterans? I know it's quite considerable, and he and I talk quite often about the work that's being done. And I'm glad that the Scottish Government's got behind that, and I hope they will continue to do so in the next year. And I look forward to hearing his statement next week on the annual review. 2020 has been a year like no other, and plans have been overturned, many businesses teeter on the brink of survival, and most serious of all, many families have lost loved ones and continue to suffer as a result of COVID-19. Hardships such as these have encouraged a sense of togetherness across our nation, which has perhaps led us to reflect and remember the contributions and sacrifices of others more keenly. And so this year's national remembrance of our fallen armed forces servicemen and women from past to present has been especially timely. Yet remembrance commemorations, as we know and recognise, have not been possible as the backdrop of COVID-19 continues to loom large. We have already witnessed this with the adopted 75th anniversaries of VE Day and also VJ Day. And unfortunately, remembrance commemorations this year are no exception. Traditionally, we commemorate with parades, services of remembrance and gatherings of serving personnel, veterans, cadets, friends and families. But this year is so very different. We have been unable to gather in public groups at our war memorials and cenotaphs. Services of remembrance have either been cancelled or undergone considerable changes. And of course, for safety to be our priority, these restrictions, while difficult, are necessary. Event organisers, for whom I am grateful for what they've done this year, across Scotland have had to adapt, rethink and reorganise remembrance campaigns and commemorations under pressure, and they have done so admirably. And I commend them all for their hard work and for adhering to the guidelines in place with absolute care and thought. And I'm pleased to see that despite these restrictions being in place, it has not stopped an outpouring of remembrance and observance. Far from it. From across Scotland and the wider UK, people have joined together in spirit, and indeed it has been so poignant to hear of many who observed the 2-minute silence on Remembrance Sunday from their doorsteps. Thousands have taken part in the Poppy campaign and have tuned into virtual ceremonies from home. And I was pleased to read of Poppy Scotland's virtual field of remembrance, where anyone can leave a tribute message online along with a remembrance symbol, such as a cross or a poppy. These opportunities ensured participation as was possible for everyone, not just a few, and the enduring sentiment of remembrance and appreciation of our forces was as tangible as ever. Many people like myself were able to individually lay wreaths on Sunday, and I laid one in Hermitage Park in Helensburgh and Christie Park in Alexandria and several villages in my own area. And what I found was moving was also the visit to the Garden and Field of Remembrance here in Princes Street, organised by Poppy Scotland. Many individual poppy crosses were laid out, very moving indeed, these in the towns and the villages which had visited, and considerably more than the last time I visited last year. It has been very much acts of remembrance by the individual this year. We remember those who have paid the ultimate sacrifice in service to their country, the fallen soldiers of the First and Second World Wars, those lost to the Korean War, at Suez, in Northern Ireland, the Balkans, Afghanistan and Iraq, and of the casualties of the conflicts we have witnessed in more recent years like those. These lives lost collectively speak not just of the seriousness of war and conflict, but the pressing need to never forget the cost of their commitment and selflessness. It is equally important to keep in our minds the Armed Forces personnel who currently represent our nation today, and I particularly want to spotlight the response of the Armed Forces in meeting the logistical challenges of this pandemic, particularly here in Scotland. Their contribution has proved most invaluable, and I am sure that I am not alone in sharing my immense gratitude for their continued commitment to our country. These servicemen and women have been actively engaged in meeting the challenges of this pandemic head-on since the very beginning. The military have transported vital medical equipment and resources to and from our hospitals. They have contributed their time and energy by helping at testing centres across Scotland. At the height of the lockdown, the RAF assisted in airlifting critically ill COVID patients from the most remote islands to hospitals to ensure they receive the best medical attention as soon as possible. The dedication of these men and women to their local communities and the wider nation knows no bounds, and I'm sure this year we have seen nationwide remembrance and recognition of a special kind as a result. Remembrance of our armed forces community today, of course, encapsulates the families of our soldiers and veterans as well. Far from waiting on the sidelines, I know from experience just how important and constant the family is in supporting their loved ones. And when the worst happens, when these loved ones don't come home, it is the family that carries a lasting burden that we should never fail to recognise nor forget. Remember, when a serviceman or woman is wounded, it is the spouse, the partner and the family who are injured. Always standing ready to support and assist the veterans community are a host of vital organisations. Legion Scotland, Defence Medical Welfare Services, the RAF Benevolent Fund, Poppy Scotland, the Royal Marine and Navy Charities, to name but a few. But I'm keenly aware of the amazing range and depth of support all veterans organisations such as these offer to veterans in need. The challenges of the pandemic have brought to light their flexibility and incredible drive to revise, adapt, expand their services in the face of heightening demand. They meet not just the physical wounds that are plain to the eye, but the lasting mental wounds some service users experience. Their contribution, especially as our thoughts turn to our armed forces community at this time of year, certainly does not go unnoticed. And this brings me back to the central focus of our debate this afternoon, the willingness of serving personnel to give up not just their own comforts and freedom, but risk their very lives to offer their service to protect the liberties of you and I. And to conclude, Deputy Presiding Officer. Yes, certainly.
Keith Brown.
For his remarks made so far during his speech. I wonder, though, he'll be aware of the campaign by Poppy Scotland to stop the service charge, whereby members of the armed forces from the Commonwealth who served in the armed forces are now facing bills and their families of sometimes thousands of pounds to stay in this country. And would he wish to support the campaign which Poppy Scotland is leading to make sure that these charges are stopped?
Maurice Corrie.
Thank the member for his intervention. And the answer is yes, I do, and I have already supported it. I think it's a worthwhile cause. I think we need to pay credence to those who've served overall. And you'll probably recall Joanna Lumley's campaign for the Gurkhas and those brave people. And I have absolutely no problem in agreeing with the member in supporting it. To conclude, Deputy Presiding Officer, commemorations may have looked different this year, but we can continue to remember the sacrifices of our armed forces, men and women, with poignancy and sincere gratitude. Far from minimising their dedication to their country, evident across history up to the present day, I join the Veterans Minister and my colleagues in sharing our strong-held thanks to those who've given so much as their legacy and will forever show, lest we forget. Thank you.
Thank you very much. I now call on David Stewart.
Thank you, Presiding Officer. It's an honour to open for Labour on this important debate. I, of course, recognise that colleagues in the Chamber and at home have their own personal and unique interactions with the Armed Forces family. We just heard from Keith Brown, who, of course, served with 45 Commando in the Falkland Islands. Edward Mountain served with the Blues and Royals Regiment of the British Army, and Mike Rumble served with the Royal Army Education Corps, retiring as a Major. And we just heard from Maurice Corrie, and I'd like to thank him for the work that he is doing in the cross-party group. Like many and probably most members in the Chamber, my interest in the debate is personal. My father did his national service with the RAF at Kinloss as fresh-faced 18-year-old nearly 75 years ago. And during my time serving in another place, I had the opportunity to serve with the RAF for 2 terms as part of the Armed Forces parliamentary scheme. And I'm proudly wearing my tie this afternoon, which I'm sure many members can actually pick out from the vision in the Chamber. I had direct experience of RAF Kinloss and Lossiemouth, as well as a memorable week in Basra as one of the first elected members in Iraq. I flew in a Tornado fast jet, an Nimrod maritime aircraft, and a Sea King search and rescue helicopter. On my last day with the RAF, the Sea King that I was involved in had to attend an emergency in Glencoe, and I vividly remember flying a few hundred feet above Loch Ness on the way to Glencoe and observing at first hand the bravery, expertise and professionalism of the pilots and the winch crew as they saved the life of a young Swiss mountaineer who had fallen and suffered severe facial injuries. My experience was a brief snapshot, but it gave me tremendous admiration for the armed forces and for veterans. And as we've heard from Maurice Corrie, this has been an incredibly difficult year for everyone in Scotland as the COVID-19 pandemic has disrupted all our normal ways of life, such as on Remembrance Sunday, that most important of days in the veterans' calendar, when we reflect upon and are thankful for the sacrifices made forces past and present who've given up their safety and their security for the preservation of others. At the weekend, my colleague Rhoda Grant and I had the honour of laying our wreath at the War Memorial in Inverness. As ever, it was a poignant moment to remember those Highlanders and Islanders who made the ultimate sacrifice on behalf of the towns, the villages and the small rural communities they were from. And of course, Sunday was a very difficult day for the over 500,000 veterans and their families across Scotland. For many, this is the most important day of the year, as they remember friends and comrades who have fallen or were injured and spent time together with those who they fought alongside, standing side by side once again. Many veterans will have been shielding this weekend because of the risk of the COVID-19 virus. And as ever, they've been performing their national duty for the greater good of all of us. I'm sorry that these services and parades couldn't take place this year, but it was the right thing to do, and it takes nothing away from the emotional toll this had for so many over the weekend. Of course, the circumstances are compounded by the effects the pandemic has had on our veterans' charities. High streets echoed with silence without many of the volunteers collecting money for the Poppy Appeal as it's shielded or self-isolated. And conscious this effect on COVID-19 will have a significant effect on the appeals collection in future finances. But I do welcome the Scottish Government's funding for the Unforgotten Forces consortium of armed forces and civilian charities will work for the health and well-being of older veterans in Scotland. But we need to be clear. The responsibility of the Scottish Government first to support veterans, and that will be important this year more than ever, as charities struggle with revenue streams through no fault of their own. So when someone gives up their safety and security for the sake of their country, they deserve to be fully supported as they return to civilian life within their country. This is the so-called Armed Forces Covenant. The Scottish Government has made welcome progress in this area, and we will continue to hold them to account as they implement the strategy for veterans report in full, but more needs to be done. Those with underlying health conditions are, of course, at greater risk from the COVID-19 crisis. Can the Scottish Government consider whether they are doing enough to effectively care for the many veterans who have concerns and anxieties as a result of the pandemic, especially those who are having to self-isolate? Specifically, I would ask the Scottish Government to provide greater support for those who are currently serving and ex-service personnel who experience mental health difficulties, such as post-traumatic stress disorder, depression and anxiety. These problems have surely only been exacerbated by the pandemic. We recognise how difficult a year has been for social care staff and residents in all Hague homes and beyond throughout Scotland. We call on the Scottish Government to ensure they're doing all they can to support social care staff in these vital roles, especially in how they support the older veterans in the care homes who struggle with self-isolation and loneliness. And the last issue, Presiding Officer, is to ensure the Scottish Government is on top of homelessness. Shelter Scotland have reported that veterans are 10% more likely to become homeless in Scotland than in England, and in 2018-19, ex-service personnel homelessness applications rose by 22%. This is a worrying trend. The Scottish Government must do all it can to reverse this and reconsider the local authority budget cuts that have almost certainly contributed to these numbers. Presiding Officer, we've been humbled again over this Remembrance weekend. Our veterans gave so much for our country. The fruits of peace we continue to enjoy today. They deserve all the support they need from the country they served in response. And it seems apt to finish with the lines of John Maxwell Emmons, repeated every Remembrance Sunday throughout Scotland. When you go home, tell with us and say, for their tomorrow we gave our today.
Thank you. I now call on Mike Rumbles.
Now, Remembrance Sunday has been like no Remembrance Sunday before. People heeded the request of the Scottish Government not to congregate around the very many war memorials in so many communities right across our country. I was fortunate myself this Sunday, as I do every Sunday, to take part in Christian worship. Of course, being limited to a maximum of 50 socially distanced people, it wasn't the same. But nevertheless, it was a moving occasion. Remembrance Sunday always brings home to me the point that others made great sacrifices so that we at home may live in peace and freedom. However, it wasn't until an event in 1993 that I really appreciated that it was much more than this. So, Presiding Officer, a personal anecdote about remembrance. My father-in-law had been a glider pilot in World War II. He took part in the Rhine crossings during Operation Varsity. I knew him as a very quiet and unassuming man. In 1993, I was stationed in Germany as a member of the British Army of the Rhine, and when he visited us, I took him to the place near Hammenkiln, where he landed his glider under enemy fire back in 1945, because I thought I'd capture his experiences with my video camera. So, while getting him at last to talk about his experiences that day, I noticed an elderly German lady walking towards us, and so I switched off the camera to avoid upsetting any local sensibilities. I wish I hadn't done that, because she came up to my father-in-law, threw her arms around him, exclaiming, "Liberator, Liberator, Frieden und Freiheit." And I can tell you that it was a very emotional moment for us all. It wasn't until that point, in 1993, that it did really come home to me that so many people gave the ultimate sacrifice, and others were prepared to make the ultimate sacrifice, prepared to, not just that we at home could live in peace and freedom, but for those who were our enemies at the time could also live in peace and freedom. Frieden und Freiheit. The poppy appeal is a symbol of that remembrance. So if I can end by slightly altering the last verse of a poem specially written for Remembrance Day by saying, "And so when you see a poppy worn, let us reflect on the burden borne by those who gave their precious all when asked to answer their country's call that we may all in peace may live. Then wear a poppy, remember and give.
Thank you very much. We now move to the open debate, and I call on Maureen Watt to be followed by Liz Smith.
Thank you very much, Presiding Officer, and I'm really pleased that the Bureau this year has timetabled to have such a debate and having more speaking opportunities for a little less time, since this year Remembrance commemorations have been so different. Normally we would have had an evening event in here to celebrate the work of Poppy Scotland, and MSPs would have been attending one or more Cenotaph ceremonies in their constituencies. Over the years, I've attended many such services at the War Memorial at School Hill in Aberdeen to pay my respects and to make sure that I laid a wreath, as indeed I did this year. For so many of us, these are times for personal reflection. My paternal grandfather fought in the First World War, and wounded himself, he carried a more severely injured colleague to safety. Forever afterwards, he walked with a limp, but continued to work on the farm. I'm sure he was often in very much pain, but he would never talk about that pain or about the war itself to myself or my other grandchildren. My mother's older brother, Jim, was a rear gunner who was shot down and killed in action in North Africa and is buried there. For this, he received the Distinguished Flying Cross, which my granny and grandpa collected at Buckingham Palace. I also remember our local greengrocer in Keith, who was a prisoner in the Japanese war camps and experienced unspeakable torture from which he suffered all his life, and it really is a sorrow that we were not able to celebrate VJ Day properly this year. I have to admit that visiting battle sites has not been top of my to-do list, but my husband has always been keen to find out where his great-uncle's grave is in the battlefields of northern France. Our daughter's move to Paris provided an opportunity for this, and eventually, after visiting a few sites, we found the grave of a Robert Donald from Banchory, Devenick, which is a small parish just outside Aberdeen. We thought that this was his grave. However, my sister-in-law, who has medals, insisted it was not, and having consulted the wonderful staff at the Gordon Highlander Museum in Aberdeen, she is probably right. Although I've visited this museum fairly frequently, indeed with the Minister, we do intend to take up the kind offer of the wonderful museum staff to find out more about the other young Robert Donald of the same name, from the same parish, whose grave we didn't find, but also we hope to revisit the area around Arras and find it. I did, from the Arras Museum, purchase this poppy brooch, which is a special reminder. And I hope sometime we can also go to North Africa, not least to see more of the work of the Commonwealth Graves Commission. The way these graves of all the fallen are tended throughout many countries is truly spectacular. The combination of plants is truly magical. The way the planting is so uniform from every angle is amazing. Here too, the War Memorials Trust have the same sort of work, and they sent us a brochure recently setting out the tireless work they do to protect and enhance the war memorials here in the United Kingdom from the ravages of time and regrettably sometimes for vandalism, which is why their other objective of highlighting public engagement is so important. Presiding Officer, this debate is about remembrance, and time doesn't permit me to talk about our veterans and the need to look after those who survived war, often with very severe consequences. and are living, which they have witnessed from horrendous situations. But as others have noted, we do have an opportunity to discuss a strategy for veterans next week, and I look forward to doing that and contributing to that debate. Thank you.
Thank you very much. I now call on Liz Smith to be followed by Kenneth Gibson.
On Sunday in Whitehall, the Cenotaph, 100 years on from its unveiling by King George V in 1920, was once again the focus of the nation's annual remembrance. The monument's simplicity and its grace, as well as the poignancy of the tomb of the unknown warrior attended by Her Majesty the Queen just a few days ago, are together the most powerful symbols of our remembrance. There may have been fewer wreaths this year, fewer veterans on parade and fewer opportunities for members of the public to pay their respects. But nothing can ever dim the memory of all those who have given their lives so that we can enjoy our freedom, or the nation's determination to remember them. As the years pass, so too do anniversaries of our war history, but the significance of our acts of remembrance only grow. These acts of remembrance, small or large, private or public, are part of the very being of this nation, and rightly so. They demand our gratitude to all those who made the ultimate sacrifice, but they should also make us think about our past and what we have to do to build a better future, because that is the real legacy that those who did not come home would really want. For all the stench and hell of war, so vividly encapsulated in many of the poems written by Wilfred Owen and Siegfried Schuon in 1917 as they convalesced in Craiglockhart Hospital in this great city, there is an obligation upon us all to reflect, and perhaps especially as politicians, to learn the lessons of the past, so that those who did not make the ultimate sacrifice, those who did make the ultimate sacrifice, did not do so in vain. Their loyalty, their dedication, their unfailing sense of duty should not be treasured because of any glorification of war, but because these attributes are those on which we can build a better future. The poppy, which is our annual personal symbol of remembrance, worn on the left side across our hearts, and representing all those battlefields in Flanders where once the guns and shells exploded, are a reminder of the peace that we seek in our world. They matter so much because they are the lifeblood of the Royal British Legion, and therefore the lifeblood of all the care that they provide for our veterans and their families who need our assistance every day of the year, whether that is helping them to address the physical or the psychological scars of battle. In normal times, 30% of the income of the Royal British Legion comes from poppy sales. But of course this year, that income was by necessity so badly affected. So it has been really good to see the extraordinary efforts to which so many communities have gone to think of additional ways to support the poppy appeal. Many showing exactly the same dogged spirit that we have seen throughout these communities to support those who have become so vulnerable to COVID-19. And what is particularly good is to see how many young people have been involved and the lengths to which so many schools have gone to, despite all the challenges that they face, to help children understand and remember. On a personal level, raising money for Poppy Scotland is part of my own small contribution. But it also helps me to remember my father, a corporal who served in the RAF in the dark days of the Mediterranean battle in Malta. Unlike so many men in his air squadron and ground crews in Lucca, he did come home from the war, but not without so many difficult memories which lived with him all the time that he lived. When this Parliament commemorated the centenary of the RAF not long ago, I recalled the fact that one of the most visited exhibits in the War Museum in Valletta is a Gloucester Gladiator biplane known as Faith, the sole survivor of the trio of biplanes Faith, Hope and Charity, whose pilots, single-handedly and against all the odds, defended the tiny island of Malta before the full onslaught of the Luftwaffe. For my father, these aeroplanes symbolise not only the ordeal of the RAF servicemen and the people of Malta who stood courageously against the Axis nations, especially when all looked lost, but also the human qualities which we need most as we each face the challenges of life. It is these human qualities which we commemorate now and for which we thank the Royal British Legion for their mainstay of remembrance.
Thank you very much. I now call Kenneth Gibson to be followed by Mary Fee.
Thank you, Presiding Officer. I pay tribute to the servicemen and women from across Scotland, the UK, Commonwealth and allied nations whose sacrifices were so instrumental in guaranteeing the peace and freedom we enjoy today. I also thank the Scottish Government for bringing forward today's debate and was particularly pleased at the mention of Jack Ransom, my Largs constituent, earlier on today. The armistice signed between the Allies and Germany on 11th of November ended hostilities in the Great War, as it was then known, the war to end all wars. Its anniversary has focused our appreciation of those who made the ultimate sacrifice. We remember those who served in all conflicts. For my family, the Great War had the biggest impact. My maternal grandfather was only 18 when mustard gassed a month before the end of the war. He never fully recovered and died at 41 of emphysema, leaving a widow and 2 daughters aged 18 months and 3 months. My paternal grandfather lied about his age to join up at 15 and served at Gallipoli and in Flanders. Sent home at 17, he missed Passchendaele before being recalled on his 18th birthday. He survived physically unscathed. However, 2 granduncles died at the Somme. Another, captured at 19, was sent to the Silesian salt mines. Hit by a guard's shovel, he died in 1921, aged only 23, as a result of those injuries. His name appears on no war memorial. With Scotland suffering almost 19% of UK Great War casualties, no doubt each of our families have been shaped by that and subsequent conflicts. When the Treaty of Versailles officially ended the war in June 1919, it understandably led to an outbreak of joy and the spontaneous organisation of victory parades across Scotland and Great Britain. However, having witnessed so much destruction and misery, many ex-servicemen and women refused to participate, believing the act of remembrance should be commemorative rather than triumphant. Events that subsequently took place on 11th of November 1919 reflected this sentiment, and many traditions formed on this first Remembrance Day, such as the 11 AM 2-minute silence, which still takes place. Sadly, a traditional Remembrance Sunday, including wreath laying at the Scottish National War Memorial at Edinburgh Castle and across Scotland, had to be scaled back this year due to the ongoing coronavirus pandemic. However, many local commemorations, such as the Remembrance Sunday service at Kilburnie Kirk, which I participated in every year since 2006, took place in line with current guidance in places of worship, and I subsequently laid my wreath at Kilburnie War Memorial, as I do every year. I therefore extend my gratitude to innovative organisers across Scotland who made huge efforts to ensure commemorations took place, either virtually or physically. One important tradition unaffected by the pandemic is wearing a poppy, which were first worn in the early 1920s after Earl Haig noticed French widows selling silk poppies to raise money for disabled ex-servicemen. Haig recognised the symbolic significance of poppies as a means to support the welfare of ex-servicemen and women, and over 9 million poppies were sold prior to Remembrance Day 1921. Funds raised were used to help veterans return to civilian life, as many were frequently confronted by unemployment, financial ruin and homelessness, while struggling with injuries and the psychological trauma resulting from the horrors witnessed on the front line. Since 1921, the Scottish Poppy Appeal has raised tens of millions of pounds to help veterans and their families. Presiding Officer, sadly, veterans today still face many challenges when returning to civilian life. The most common include unemployment, education, skills, debt, health and making a home. The sacrifices made by veterans often create unique difficulties, requiring a different kind of support from those offered to the civilian population. I commend the incredible work done by Poppy Scotland in partnership with the Royal British Legion Scotland, who together raised £2.95 million through the Poppy Appeal last year, backed by the Scottish Government. These funds are absolutely vital in delivering life-changing services, making a real difference to Scotland's armed forces community. This includes working with specialist partners such as the Scottish Association for Mental Health, Veterans First Point or Combat Stress, each of which provides a wide range of practical support and mental health services to ensure veterans and their families enjoy the highest possible quality of life. And I should also say that men's sheds also play a very positive role. Presiding Officer, it is our duty to both remember those who made the ultimate sacrifice and appreciate our living veterans by continuing to support them in any struggles they might face after their service to the country.
Mary Fee, followed by Sandra White.
Presiding Officer, thank you for this opportunity to speak today, and to Graham Day for bringing this very important debate to the Chamber. Freedom is a gift, and the year 2020 has acknowledged this to so many generations. And watching the Remembrance service on television made me reflect that this global pandemic has removed the opportunity for our veterans, young and old, to visibly honour and recognise the fallen and those injured in service of their country. And the restrictions on gathering together to remember our veterans made Sunday a very difficult day for many. However, we must continue to prioritise suppressing the virus to save lives, and I applaud those people who stood at their doorsteps on Sunday. And how we support our veterans is a measure of our remembrance. And I would like to pay tribute to charities such as Legion Scotland, Poppy Scotland and Erskine, who I have the privilege of representing in my region. And I applaud them for the way they have adapted during this pandemic and continue to deliver the highest possible standard of support to our veterans. And Scottish Labour welcomes the funding from the Scottish Government to Unforgotten Voices, a consortium of armed forces and civilian charities working to boost the health and well-being of older veterans in Scotland. It should be noted, however, that not all veteran charities receive such a level of funding, and funding will become a major issue as the pandemic continues and charities deal with increased pressure on resources and decreasing revenue streams. In 2018, the Poppy Appeal across the UK raised a record 55 million, distributing 40 million poppies and 7 million pin badges. However, organisers state they are bracing themselves for a greatly reduced collection this year because of the impact of the pandemic. And volunteer numbers of those who normally are out in public rattling collection boxes and selling poppies has also fallen sharply because many are shielding or self-isolating. And I'd like to highlight some of the key workers who have tried to keep some sort of normality for our veterans throughout this pandemic. Key workers like Alana Kerr, who lives in my region. And Alana works for Coming Home, a Glasgow-based charity that supports 400 registered veterans. And with the assistance of David Gibson from Fares for Free, they have distributed weekly food packages to 120 families over the west coast of Scotland since March of this year. And Coming Home works with veterans at the point of needing assistance with issues surrounding mental and physical health, homelessness, housing, benefits advice, employment, training, and most importantly, friendship and camaraderie. Their support is crucial to the veterans they help. And Presiding Officer, housing is a key issue for veterans, especially those who have been dependent on military-provided accommodation. And Shelter Scotland tell us that veterans are more prone to homelessness than non-veterans. And we must ensure that all, but particularly our older veterans, can rely on safe, good quality and affordable housing. And many of our veterans bring long-term conditions back home with them. And it's crucial that we provide economic and social support for vulnerable veterans who are suffering with PTSD and other debilitating conditions, and give our veterans the support they need to take part in further education and training. We must continue to ensure that veterans' specific needs are supported for the duration of the pandemic and beyond, taking account of the barriers they face, particularly in relation to their mental and physical health, and in accessing and retaining housing. Long-term support is crucial for our serving and ex-service personnel experiencing mental health problems such as PTSD, depression, anxiety, alcohol misuse, and those who experience concern, stress or isolation. And in closing, Presiding Officer, can I put on the record my support to all of our service personnel who continue to give so much for us all. Thank you.
Two quick things before we move on to Sandra White. First of all, can I remind all members it's 4-minute speeches for this, and so we're already running short of time. So it's 4-minute speeches, and can I ask all of those who wish to speak to make sure that their cards are in their slot and that they have pressed their button. Thank you. Sandra White, followed by Fulton McGregor.
Thank you very much, Presiding Officer. And I'll keep my eye on the clock. I think others have already mentioned the fact that this Remembrance Day has been very, very different from any other Remembrance Day, many previous ones. And many events, as we know, have been held online. And some people have stood at their own front doorsteps. Individuals have took part in this in their own simple way to pay their respects. And I do thank them all for contributing and doing that as well. I want to start my contribution with a quote, and I hope he will forgive me on this, from Keith Brown, the previous Veterans Minister, which to me encapsulates all and perhaps encapsulates some of the other contributions as well. It starts with, we have a responsibility to learn from the lessons of the past, and Remembrance Sunday should be a solemn, dignified occasion when we commit ourselves to ensuring that our own and future generations are spared the horrors of war. Over a century on from the devastation of the First World War, which left barely a community or a single family untouched by tragedy and loss, it remains as important as ever that we come together across Scotland to commemorate those lost in all conflicts, past and present. And I think we need to remember that all conflicts. Now, the reason I raised this and I wanted to speak in this particular debate is in my own constituency, the University of Glasgow have been very involved in their project. It's a World War I project, and it marked the death of every member of the university community who died in the war, regardless of what side they actually fought on. The university's project officially launched on the 25th of September 2014 with the first war death of the university's community. Captain Harry Sherwood Rankin, who was the Glasgow-born recipient of the Victoria Cross, posthumously awarded the commendation after he died from his wounds. The University of Glasgow's Great War Project to remember every member in its community to lose their lives officially ended on the 3rd of March this year, 2020, with its last commemoration service. The University of Glasgow sacrificed a significant proportion of its membership to the Great War. Over 4,500 served in the First World War and 781 lost their lives. And in tribute and acknowledgement, there was a planting at the Memorial Gardens for the Great War, which was designed by William Bell, gardener in estates and buildings, in time for Remembrance Sunday. And I'm sure some people who are familiar may have visited that area. The colours selected represented conflict, which is red, peace, which is white, and hope, which is pink. The University chaplain, Reverend Dr. Caroline Kelly, quoted, "The fortitude and courage of those who commemorate, who faced life and death in the world wars and in conflict since, is an inspiring example to our communities grappling with the painful realities just now of the COVID pandemic. During recent months, subsequent generations have perhaps gained greater insight into the hardships faced by those who lived through the hostilities and beyond. And perhaps we better appreciate what it meant to lose customary freedoms, defer celebrations and to grieve loved ones, distantly or untimely death. Thus, we will remember them." Thank you very much, Presiding Officer.
Fulton McGregor, followed by Alexander Stewart.
Thank you, Presiding Officer. It's a great privilege to speak in this debate today. And as others have already said, it's a very different Remembrance Sunday this year. And this was right. COVID-19 has impacted on every aspect of our life since March, and Sunday there was no exception. It would not have been right, or indeed, in my opinion, respectful, to have the usual full gatherings and services at memorials up and down the country. However, it is important as ever that we remember those who sacrificed their today for our tomorrow. Indeed, in some respects, it was even more poignant this year. This pandemic is the most challenging global event that we have experienced since the wars. And again, like the wars, we witness people step up to the front line to protect us. The health workers, emergency services, supermarket workers, and the many other key workers. And of course, As we know, this includes the armed services themselves, who continue to play a key role in our fight against COVID, for example, at testing sites. Presiding Officer, it's also been an opportunity to find other ways to remember this year, and therefore I'd personally like to thank the Reverend Dave Slater of Gartcosh and Glenboig Parish Churches for his invite to participate in a virtual service. And this involved me attending at both war memorials and laying a wreath on the Saturday before and recording it on video to form part of the service, which was aired the next day. I thought it was a very good way to mark the day, and there was some fitting tributes at the memorials, at both memorials, from local schools, boys' brigades and others. The community still showing their appreciation and remembrance. And I know there were many other examples of this throughout Scotland and the UK, but I'd like to thank North Lanarkshire Council for making sure that there was someone to lay a wreath at the major memorials across the council area. And you can see examples of that on Twitter and Facebook later in the day, maybe just one person, a councillor or an official laying a wreath. And tomorrow, Presiding Officer, I'll lay a wreath at the Cenotaph in Coatbridge on behalf of all constituents on Armistice Day. Of course, on the issue of the Coatbridge Cenotaph, I have to mention, Presiding Officer, since being elected, I've had to stand up in this chamber on numerous occasions and condemn vandalism of this particular memorial. And I'll therefore take this opportunity to reiterate this plea. Please do not vandalise the memorial. Do not do it any year, but especially this year, as I think we've all had enough. And I won't labour the point on this particular issue because the last vandalism was over a year ago, but I would just say please just don't do it. Presiding Officer, to move back to a much more positive note and when finishing and while thinking about innovative ways to remember, I want to take this opportunity, again as I did in Tom Arthur's members' debate last year, to pay tribute to 3 local men, Les Jenkins, Stephen Buke and John McCann, for the incredible work they have undertaken to commemorate those remembered on the Coatbridge Cenotaph. Mr Jenkins, previously a history teacher at Coatbridge High, worked in the programme of the War Memorial for more than 35 years, which will have included, he might not like this, but will have included the time when I was at school, and indeed one of his pupils. He completed this work in the centenary year. He has compiled the stories of all 863 First World War fallen who are on the Coatbridge Cenotaph, and these stories are now available in a series of folders at Airdrie Library. John McCann and Stephen Buke have worked together and created a website which is a culmination of more than a decade of research by John, who travelled across Europe to piece together scraps of information that was recorded about the brave fighting men from Coatbridge who lost their lives during the Great War. And I know at the time of the debate last year, this website had received over 54,000 views and had support of the families of the fallen. Presiding Officer, these projects were started well before COVID-19 and completed, relatively speaking, just before it. But they're examples of incredible work that will have brought comfort to so many this year when we've had to remember in a very different way. Thank you.
Alexander Stewart, followed by Annabel Ewing.
Thank you, Deputy Presiding Officer. I'm pleased to be able to take part in today's debate, and I'd like to thank Minister Graham Day for raising this important issue in the Chamber. It is often easy to take the freedoms that we have for granted. This year, however, we have been confronted with the stark reality of what has happened, and that has curtailed many of our freedoms. We have all faced restrictions on what we can do, who we can meet, and where we can go. And whilst these restrictions are temporary and for good reasons, we seek to tackle the coronavirus. It is and gives us an idea of what freedoms might have been like if we had lost them forever. Brave men and women fought to protect our freedoms in world wars and conflicts since. Their sacrifice and selfless succession for the ability to make sure that freedom is our freedom, and freedom of speech is able, freedom of press, freedom of association and freedom for religion. All of these, Presiding Officer, we take for granted. Without their incredible efforts, these restrictions we will have had may have been very much curtailed. Remembrance is a small, simple act, but one that is so very important. It is sometimes what we reflect upon, and the veterans who gave a huge contribution to our society. The motion recognises that what the members have acknowledged across the Chamber, that coronavirus has had a massive impact on celebrations and our commemorations this year. Social distancing has sadly meant that communities the length and breadth of the country have not been able to do what they have done for many decades. But it is important that we stop and we ensure that people do remember. And I thank and acknowledge Poppy Scotland and Legion Scotland for their efforts. Many churches, charities, councils, community groups and veteran organisations across the length and breadth of Scotland have worked so hard to ensure that safe wreath laying and socially distancing has taken place to ensure. And I was glad that I was able to lay a wreath at Bridge of Allen and at the church service that was able to take part. And these acts of remembrance across the country are incredibly important. And since my first elected as a councillor back in 1999, I had the opportunity to lay wreaths at the Polish war graves at Wellsdale Cemetery in my former council ward. And I was pleased that I had the ability to once again do that this year. It remains and reminds us of all of the veterans who supported us outside the Commonwealth and who fought alongside our troops. And it's vitally important that we remember the contribution that they gave to ensure that we have the liberties that we have today. We've already heard that anniversaries like the victory on Europe and the victory in Japan that were supposed to be celebrated were not able to take place. But I'm hoping that these will take place in later times. And I note that across Mid-Scotland and Fife, much has been supported and many people have managed to participate. So in conclusion, Deputy Presiding Officer, I want to again pay tribute to the enormous contribution that our veterans have made at home and abroad to uphold the freedoms that we hold so dear. It is heartening to know that tomorrow across the country, people from different backgrounds, across different political devices, will come together to act and remember. And that's so important that we have that act of remembrance. And let us hope that next year we can unite in person as well and come together to support one another and support these individuals who gave the ultimate sacrifice so that we could ensure and enjoy the liberties we have today. Thank you.
Annabel Ewing, followed by Stuart Stevenson.
Thank you, Presiding Officer. And as we have heard, we have seen this year a very different Remembrance Sunday to that which we have commemorated in previous years as a result of the global pandemic. But notwithstanding COVID-19, communities across Scotland have ensured that their respect was marked. And in my own constituency of Cowdenbeath, we witnessed commemoration in every community in some form or another. And I will list these communities because their mark of respect is hugely important to them. So we saw some commemoration in Aberdare, in Dalgety Bay, in Inverclyde, in North Queensferry, in Hill End, in Rosyth, in Cowdenbeath, in Hill of Beath, in Crossgates, in Coledge, in Lumfinnans, in Lochgelly, in Kelty, in Benarty, and in Cardenden. And in each of these communities, community councils, local volunteers, Fife Council workers, and of course veterans charities, Poppy Scotland and the Legion, ensured that the war memorials were prepared, that community spaces were tidied, and that there was in place a form of organised structure to meet the needs of commemoration, whilst at the same time, of course, adhering strictly to the coronavirus regulations designed to keep us all safe. And I would wish to express my heartfelt thanks to all those community councils, all the local volunteers, all the Fife Council workers, the veterans organisations, and of course, as Maureen Watt rightly said, the Commonwealth War Graves Commission and the War Memorial Trust for all that they did this year and all that they do every year. For my part, I laid wreaths on Scottish Parliament wreaths on behalf of my constituents at the allotted time slot I was given, not just at Cowdenbeath Town Hall, but also at the First World War Memorial. And Presiding Officer, I was struck, as I always am, when looking at the long list of names of the fallen engraved on the memorial, how young the men were who made the ultimate sacrifice, and how many were from the same families. And in this year, the year of the 75th anniversary, not just of VE Day, but also VJ Day, I also turn my thoughts to my late uncle David Woodburn, the elder twin brother of my mother, for he had served in the Far East and he was held as a prisoner of war in the notorious Japanese POW camp at Changi in Singapore. Happily, he returned home to raise a family and to pursue a successful career with the Forestry Commission in the north of Scotland. Presiding officer, there is no single community across Fife, nor indeed across Scotland, that has not been impacted by the losses of war, and not even a global pandemic has stopped the people of Scotland from sharing their experiences and showing their respect, albeit in a different manner to that in previous years. Tomorrow, of course, is the 11th of November, and there is another opportunity to mark our respect by observing the 2-minute silence at 11 a.m. For it was on the 11th day of the 11th month at the 11th hour that the Armistice Treaty of Compiègne was signed. And in marking the occasion, the writer and poet Thomas Hardy penned his poem, "And There Was a Great Calm," and I quote from the last stanza of that. Calm fell, from heaven distilled a clemency. There was peace on earth and silence in the sky. Some could not shake off misery. The sinister spirit sneered, it had to be. And again, the spirit of pity whispered, why? Thank you, Presiding Officer.
And the last of the open debate contributions is from Stuart Stevenson.
Thank you very much, Convener. It's a privilege to be here to be able to speak in a debate of this kind. And the privilege, of course, is entirely due to the sacrifices of hundreds of thousands of people who've gone before us to protect our freedom. One of my hobbies is, of course, researching my family tree, something I've been doing for well over 50 years. So I'm able to say that in my family tree, I have 38 relatives of mine who've died in various conflicts. Every other member who's spoken will have similar numbers. They just haven't done the research to find them all. They range from first cousins of my father to great uncles to as distant as a seventh cousin. Indeed, I have on the library shelf beside me something which is a memento, naval telescope from the First World War, which was one of my father's cousins' telescope. He was with my father and the rest of the family in the Black Isle when the siren went at Invergordon to recall him back to his duty on the minesweeper that was based there. The minesweeper left port but never returned because it collided with a mine and was blown up. And this is the tangible memory of that particular member of our family. The COVID crisis has caused me, and I think many others, to do much more walking than we used to. Within the compass of the walks that I've been able to undertake from my home here in Banffshire, I pass 4 war memorials, the closest of which is half a mile away. The next one is about 2 miles away, and so on. But I think one of the important things too is that I also pass graveyards where there are graves that are tended by the Commonwealth Graves Commission. And we haven't in the debate so far had any reference to the work of the Commission. Around the world, there are memorials to those who fell in the wars. These memorials are maintained to the highest and most impeccable standards and with most fulsome and appropriate records kept in books that you can inspect at most of them. The most poignant one that I visited was quite a long time ago in 1978, about 20 miles north of what was then called Rangoon in Burma, where there was a Commonwealth grave, a huge cemetery. Every blade of grass was cut to exactly the same height. It was impeccably kept. And the contrast with the state of the Burmese country at that point, where I could only get a 48-hour visa to visit, and the only one hotel in the entire country was working, could not have been more stark. The efforts made in that very difficult environment to respect our war dead were extremely impressive indeed. My ancestors, my relatives fell at the Somme, at Passchendaele, Ypres, at Flanders, at Normandy, and indeed around the world. Let me just close by saying one thing again that we've not heard mentioned. We've talked about all the men who fell. Actually, there are women in war memorials as well, rather fewer than the number that men are. But I would like to remember in particular the women who served as agents in enemy-occupied Europe. They paid a sacrifice even greater because they were solitary than many who fell on our battlefields. It's a time to remember, a time for gratitude. Presiding Officer.
We now move to the closing speeches and I call Alex Rowley for up to 5 minutes, please.
Thank you, Presiding Officer. Labour supports the motion tabled today by the Government, and we appreciate the importance of honouring those who made the ultimate sacrifice. And while doing so this year was different, we applaud all those who stood at their doorsteps on Sunday, people who laid wreaths at war memorials to remember those who'd fallen, or went to church. But right across Scotland, there were people marking the fact that we should honour those who paid the ultimate sacrifice. The restrictions on gathering together to remember our war dead made Sunday very difficult for many. However, we agree that we must continue to prioritise suppressing the virus and saving lives. That said, this year's Remembrance was particularly poignant, coming as it did with the world's eyes focused on the election in America. The American election had its largest turnout ever, which is a vote of confidence for democracy. And it is always worth reminding ourselves, if it had not been for those who gave their lives in the world wars and those who suffered so much, there would be no democracy. And that is the debt we owe the people who gave so much so that we could live in a democracy. I also want to mention those who have lost their lives in recent conflicts. Last year I tabled a motion in Parliament that named every person who'd lost their life in Iraq and Afghanistan in the conflicts there. Today I think of their families, the mums and dads, the wives, the sons, the daughters, for their grief is still very much raw and their loss unimaginable. While we salute the work of charities in their support for veterans, we have to accept that if the state asks people to go to war, then it must bear the responsibility of addressing the sacrifices made by soldiers and ensuring that they're looked after when they come back home. This is particularly the case this year, where many charities like Help the Heroes are struggling with the strain on their resources brought about by the pandemic. So Remembrance Sunday is important that we remember those who died, but equally as important when we have debates like this, that we remember those who lived and those who need our support and our help now. Many people who have fought for their country come back with long-term conditions. We need to make sure that we provide top-class economic and social support for vulnerable veterans who are suffering with PTSD and other debilitating conditions. The Government has acknowledged areas for improvement under key themes, including employment, education and skills, finance and debt, health and well-being, and making a home in civilian society. We need to see better collection and use of data to identify and address veterans' needs, and increasing public recognition of the positive contribution veterans make to wider society. Labour also wants to see more support for serving and ex-service personnel experiencing mental health problems such as post-traumatic stress disorder, depression and anxiety disorders, and alcohol misuse. There needs to be earlier identification as identified by the new review commissioned by the Force and Mind Trust, conducted by the National Centre for Social Research. Further support for older veterans to deliver services and enhancements in areas including advice, access to healthcare, social isolation, respite, along with creative activities and events for those in care settings is required. We also need more support for veterans who are experiencing concern, stress, isolation as a result of the coronavirus pandemic. Housing is a key issue for veterans, especially those who have been dependent on military-provided accommodation. As Mary Fee said earlier, Shelter Scotland have said that veterans are more prone to homelessness than non-veterans and are 10% more likely to become homeless in Scotland than in England. So whilst, Presiding Officer, we come here today and we remember those who paid the ultimate price, speeches is one thing, but action requires another. I look forward to the Cabinet Secretary, to the Minister for Veterans making his report next week, and we can perhaps pick up some more of those issues then. Thank you, Presiding Officer.
Colin Edward Mountain for up to 7 minutes, please.
Thank you, Presiding Officer. And first of all, I'd like to refer members to my register of interest in that I am officially a veteran. That I have to say that term makes me feel very old, which according to my children, of course, I am, but knowing that, I prefer to call myself an ex-soldier. I'm the third generation of my family to have served in the armed services, and with my son serving, that makes it 4. This last weekend felt very odd. No formal parade to go to. With many ex-servicemen and women, I wondered whether standing on our doorsteps would be the same as standing shoulder to shoulder with our colleagues. Obviously it wasn't, but what it did do was allow each of us to think about what the day really meant. It isn't, as some people wrongly suggest, about celebrating or glorifying war. It is about remembering those that have answered the call and often given their all to protect the very freedoms that we, on a daily basis, take for granted. We must cherish those freedoms that we have and never forget that this has been gained by the sacrifices of many. Now, I think I can confidently say, like most other service personnel, that next year I do hope that we can take part in community remembrance services. For the simple reason, I don't want to just remember those that gave their all. I also want to rekindle the friendships that I have with those that have shared experiences. Now, Presiding Officer, I want to mention an event that happened on Sunday. Whilst laying my wreath, I met a young lady who was wearing a relative's medals. I chatted to her and discovered that they were her grandfather's medals, which were awarded, incidentally, during the time I would have been serving. I said how important it was that she was wearing them because we all owed her grandfather so much. As I left, her father turned to her and asked her if she was now happy that she had worn them, and I heard her say that she was. And it's right that she was, because we need to recognise that while we have laid sleeping in our beds at night, there are those that have watched over us to make sure that the peace we cherish continues. I also want to take a moment to pay tribute to those residents in Granton who not only have created a remembrance cairn of painted stones, but also created a special type of poppy, a poppy fashioned from the bottom of a plastic bottle that, when shaped and painted, looks remarkably like poppies. And it is these poppies that they laid out in the town centre, showing all those that had given their lives in wars. Now, it's very difficult, Presiding Officer, in the short time that I have, to comment on the 15 contributions that have been made. But I would like to try, if I can, to pick out some of the salient points which I think tie them all together. First of all, we heard from the Minister about the contribution of Legion Scotland and Poppy Scotland. They are so important in protecting and helping our veterans. And we heard also from Maurice Corrie about how important that it was to remember that the scars of war are not always visible. There are mental problems that are real, as well. And we also heard from Maurice about the importance of the families that are left behind. It is them that have to pick up the pieces when things go wrong. And we heard from David Stewart, who told us that all of us, somewhere in our history, have a connection to the armed services. And we heard from Mike Rumbles about how his father-in-law met a German who recognised him as a liberator. And we heard also from Maureen Watt something that is a common theme, which I hear about veterans who don't talk about the things that they've been through. It is frankly sometimes too hard. And I was interested in Liz Smith's contribution about Malta. Now, there's an island that struggled. And she told us about an aeroplane. Now, I think Roald Dahl described this aeroplane by saying, if a clever man, now let me get this right, set about to build a big thing that would burn better and quicker than anything else in the world, it would be a Gloucester Gladiator. So who would be brave enough to get into one of those flying machines that burnt so quickly there was little chance of you getting out? And we heard from Kenneth Gibson, who said that many of young soldiers in the First World War had joined up having lied about their age. That is because they had a feeling of commitment. And we also heard as well from Mary Fee, who said that the support that we give our veterans is actually an act of remembrance in itself. And Fulton McGregor and Sandra White also said between them that we must learn from the past. And Fulton was very important in McGregor in what he said about the importance of involving local schools in events. And Alexander Stewart stressed the importance of never taking anything for granted. And I want to pick up on something that both Annabel Ewing and Stuart Stevenson mentioned, and that is the importance of the Commonwealth War Graves Commission. What an important organisation, an organisation that strives not only to ensure that we bury all the soldiers that are now continually being exposed in France, but also those that were found after the war and buried in graves that were similar, not depending on rank or status. That is a very important organisation. Now, Presiding Officer, I'd like to say at 11 o'clock tomorrow, the nation will fall silent as we remember those that gave their all for the freedoms that we cherish. And I would encourage everyone to stop and reflect and give thanks, because what we remember is encapsulated in my mind in verse 13 of chapter 15 of the Gospel of St. John. Greater love has no one than this, to lay down one's life for one's friends. It is their sacrifice tomorrow that we will remember tomorrow. And let's hope next year, Presiding Officer, we can all stand together in national remembrance at the war memorials across Scotland.
Colin Graham Day to conclude the debate. Please, if you take us to decision time, please, Minister.
Presiding Officer, can I thank members for their contributions today? There were some really valuable points raised, and I want to begin by drawing some of these together. Maurice Corrie and Edward Mountain and others reflected on how different Remembrance had out of necessity been this year. But Maurice Corrie noted that he's still been able to lay a wreath locally and visit the National Garden of Remembrance here in Edinburgh. I managed to do the same thing. I laid a wreath at the garden on behalf of the Scottish Government, privately, rather than with the usual formal ceremony. And I didn't feel it was less valuable because of that. Maureen Watt and Mary Fee welcomed the scheduling of this debate. Can I say, in proposing it to the Bureau, I felt it was the least we could do in light of the special circumstances we find ourselves in this year. But I think the Chamber would agree that future business managers might want to make this a feature of the parliamentary timetable, because I think the contributions and the volume of contributions we've heard today have shown how valued it has been. We had very thoughtful and moving contributions from Mike Rumbles and Sandra White and Liz Smith. Liz Smith noted the threatened drop in income to be suffered by Poppy Scotland and the appeal this year. And I would encourage everyone, even at this late stage, to donate and support the vital work they do. Kerry Gibson and Annabel Ewing, amongst others, highlighted the extent to which families right across Scotland have one way or another been impacted by war. And then they were very much right to do so. And Fulton McGregor highlighted, as I did in opening the debate, the work of local authorities in adapting the weekend commemorations. And again, I would commend the councils for that work. Mary Fee noted the work being done by the Unforgotten Forces Consortium and other charities before and during the pandemic. As Veterans Minister, I was hugely impressed to learn of the projects that Unforgotten Forces have deployed the Scottish Government funding to support. I can also tell the Chamber that as recently as last week, I met virtually with Poppy Scotland and Veterans Scotland to discuss the challenges and financial and otherwise that the pandemic is posing the sector, but also the way in which the charitable sector is responding to these. Alec Rowley noted a number of things that we will undoubtedly cover in next week's Veterans Annual Update. On a much lighter note, Presiding Officer, I noted that you're letting Stuart Stevenson off with using a prop to illustrate his typically colourful contribution. It's truly amazing the things you get away with these days when you're contributing virtually. But to be serious, I want to reflect further on the importance of the remembrance period in the present day. Tomorrow is the 101st anniversary of the first Armistice Day on the 11th of November 1919, and understandably, at the time, the focus was very much on the huge number of young men who never returned home from the First World War. In the century that's passed since then, the concept of remembrance has evolved and now encompasses a much broader range of individuals and events which could not have been imagined at that time. In my opening comments, I talked about some of the significant anniversaries we've seen this year, in particular the 75th anniversaries of VE Day and VJ Day and the 80th anniversary of St Valerie. It's important, though, that we do not forget the huge range of other events which don't get the same level of attention or recognition because they could not compete with the magnitude of the tragedies unfolding on the battlefields. As events such as the quintessential rail disaster on the 22nd of May 1915, which remains the UK's worst rail crash, with more than 240 people dying in a triple-train pile-up on a siding near Gretna. 216 of these individuals were Royal Scots on their way to Liverpool to set off for Gallipoli. Or how the loss of the HMY Islair, taking the lives of 200 men as it smashed on the rocks within sight of their home port of Stornoway on New Year's morning in 1919. How devastating that would be for the unspoken grief that surrounded that, which recently has come more to the fore. There are also many stories of people who achieved remarkable things in the face of war. Not least Dr. Elsie Ingalls, more used to caring for new mothers in Edinburgh than wounded soldiers. And despite the War Office telling her to go home and sit still when she offered her services, she recruited 1,500 women to go with her and set up frontline hospitals in France, Romania, Greece, Russia and Serbia, where she remains very much revered to this day. The role of the Merchant Navy is another which is often overlooked, despite the incredible bravery and resilience they showed through, for example, the Arctic convoys and transporting vital supplies. The impact of war at home too has been immense, and we should not forget the suffering of families at home, facing the future, uncertain of what would become of their loved ones. For those that didn't come home, that suffering never ends for war widows and their other family members. Going back through history, Scotland has always had a close link with its armed forces community, regardless of where those concerned originally hailed from. And it's important to remember our links with the Commonwealth and countless men and women from around the world who fought and suffered alongside the peoples of the United Kingdom and Scotland. Last year, I had the privilege of speaking at a commemoration of the men of Force K6, the first element of the Indian Army to be deployed in Europe in the Second World War, many of whom were at the evacuation of Dunkirk. It should go without saying that had it not been for the 2.5 million men who volunteered for the Indian Army during the Second World War and the many millions of others from elsewhere around the Commonwealth, we here in Scotland would not enjoy the freedoms that we take for granted today. Their bravery and their commitment contributed immensely to victory in 1945. Remembrance is a time for reflection, and there should always be time within that to reflect on our personal links to the past, as we've heard today. And I was particularly struck by David Stewart's point, reminding us of how difficult it must be for many veterans at this time of year, when they are almost forced prompted to recall comrades lost in past conflicts. And that cannot be easy, Presiding Officer. Armistice Day and the Remembrance period more broadly serves a vital purpose in allowing everyone in Scotland a moment to pause, reflect and be thankful to those who've made the ultimate sacrifice, be that in either of the two world wars, Korea, Afghanistan, Iraq or anywhere else. Presiding Officer, it is important that we continue to remember those who served and lost their lives in all conflicts, not to glorify war, but to recognise the sacrifice made, in many cases to protect the freedoms we enjoy today. And I want to conclude, Presiding Officer, by again noting my thanks for the contributions of members. To have had 15 or so members take part in this debate really does speak volumes for the importance that the Scottish Parliament places in this issue. And I hope in years to come we'll have similar opportunities to commemorate the Remembrance period. Presiding Officer.
That concludes the debate on Remembrance commemorations, and we'll move on to the next item of business. And the next item of business is consideration of business motion number 23308 in the name of Graham Day on behalf of the Parliamentary Bureau, setting out a change to tomorrow's business. Any member who wishes to speak against the motion should press the request to speak button now. I call on Graham Day to move the motion.
Moved, Presiding Officer.
Thank you. No member has asked to speak against the motion. Therefore, the question is that motion 23308 be agreed. Are we all agreed? Yes. The motion is therefore agreed. There's one question to be put as a result of today's business. And the question is that motion 23291 in the name of Graham Day on Remembrance commemorations be agreed. Are we all agreed? Yes. The motion is therefore agreed. That concludes today's normal business, and we'll move on to members' business very shortly. And can I remind members that social distancing measures are in place in the chamber and across the Holyrood campus, so please take care to observe when you're leaving the chamber.
How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a balanced one. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.